96.9 FM. Fresh news, smart talk, all day. The views and opinions of the hosts and guests are their own and do not necessarily reflect the position of the management and staff of Guardian Network.
Good morning. Crisis at Princess Margaret Hospital. Patients forced to wait for care. Non-COVID patients now overwhelming the system. The National Security Minister advising the public about a sex offender's release. And 21 Chinese arrested after a $1.3 million drug bust. It's all straight ahead this morning. I'm Dwight Strachan, and this is Morning Blend.
Wake up, it's a new day. Wake up, it's a new day. It's the start of a new way. You know that it's the start of the end of the old way. Wake up, it's a new day. Wake up, it's a new day.
Good morning again, Bahamas. It is Monday, May 23rd, 2022. This is Morning Blend on Guardian Radio 96.9. Again, I'm Dwight Strachan. Pamela Musgrove is on vacation. We'll be off today. Also this morning, we will be talking with Doctors Hospital about their LAMP program, some exciting initiatives, a partnership they have with a major insurance company. They're going to tell us all about that. And later in Morning Blend Business, we are talking with the president of the PMU, the Public Managers Union, about the challenges they've been facing with NIB. But first, it's time for the overnight, the latest breaking news from while you're sleeping, and the top national and international headlines this morning. In the overnight with Princess Margaret Hospital operating at maximum capacity, consultant surgeon Dr. Loxie Monroe says the healthcare system is challenged by patients who were unable to have elective procedures done as a result of the COVID pandemic. Monroe is saying that people who ought to have had things done in 2020 are just now in a much worse position. He says they're looking at resources being outstripped because patients who may have had something like a hernia were unable to have it reduced. That hernia is now incarcerated or strangulated. He says someone who may have had a stage 1 cancer because of no access are now looking at stage 4. He says the conditions have gotten worse for many, many other patients during the time of COVID because many were afraid to come in to get treatment for their conditions. Last week, the Public Hospitals Authority announced that PMH was operating at maximum capacity as a result of non-COVID patients accessing care at the hospital. PHA said that as a result of decreased bed capacity, 40 patients at the hospital's emergency room were awaiting admission. As of Thursday, non-COVID hospital operations, resources, and services have had to be adjusted, and face-to-face outpatient services, including elective surgeries and specialty clinics, were limited. The authority also saying that the PMH Family Medicine Clinic at Agape House was offering limited services as nurses were being redeployed to PMH. 23 more beds are expected to be added to the capacity by Friday. 21 Chinese nationals arrested after law enforcement officers discovered 68 kilos of cocaine worth an estimated $1.3 million. This was on one cargo vessel moored at the Nassau Container Port. When officers arrived at the port around 8 a.m., they deployed police dogs and alerted their handlers to several areas of the vessel. The group arrested included 20 Chinese men and one Chinese woman who were on the vessel. That vessel left South America before arriving in the Bahamas. A 55-year-old sex offender released from the Bahamas Department of Correctional Services. The man identified as Alden Scott, who's been added to the sex offenders register. He was released on Friday. Scott was sentenced to 2 years in prison last year after he admitted to caressing a 9-year-old at her home. This was on her thigh. Prior to this sentence, Scott had been released from prison for raping a 17-year-old girl, for which he received a 9-year sentence. National Security Minister Wayne Monroe saying Scott has been deemed, quote, a risk of significant harm to the health and safety of the public as opposed to a particular individual. He said prison officials advised him to alert the public of Scott's release. Monroe saying during a press conference Friday, quote, this is an offender who has shown no age preference in victims. His history shows offenses against a child of 9, a young woman of 17, and while in the correctional institution, behavior towards adult females. The registrar of the sexual offenders list and the commissioner of the correctional institution deem him a significant risk to public safety. And Bahama President Graham Davis says the government should remove its COVID testing requirement for people entering the Bahamas. Davis saying as we're more and more competitive for the Caribbean region, it's important that we also are competitive when it comes to entry requirements and COVID testing. Davis saying that Aruba's dropped their COVID testing and Jamaica has as well. He said, quote, we certainly want to see the drop in COVID testing to enter the Bahamas, as well as the removal of the health visa as quickly as possible to keep us competitive with the other island destinations that we're up against here, particularly in the summer season, which is a more value-driven audience that's coming here to the Bahamas. Well, the government requires that vaccinated travelers have a negative rapid antigen test result to enter the country, and unvaccinated travelers are required to have a negative RT-PCR test result. The test can be no older than 3 days old. While many of the COVID-related restrictions that were imposed at the height of the pandemic have been lifted, some, like testing requirements and national mask mandates, remain in effect. Overseas, breaking news, a Ukrainian court has sentenced a 21-year-old Russian soldier to life in prison for killing a Ukrainian civilian, sealing the first guilty conviction for war crimes since Moscow's invasion 3 months ago. The sergeant pleaded guilty to shooting a Ukrainian civilian in the head in a village in the northeastern Sumy region in the early days of the war. He testified that he shot the man after being ordered to do so. He told the court that an officer insisted that the Ukrainian man, who was speaking on a cell phone, could pinpoint their location to the Ukrainian forces. The sentencing coming as the 3-month-old war helped push the number of people displaced worldwide to the highest level on record, according to the United Nations, with more than 100 million people driven from their homes across the globe. Meanwhile, Ukrainian President Volodymyr Zelensky addressing the World Economic Forum as it opened in Davos, Switzerland, calling for maximum sanctions against Russia. He said by video that sanctions needed to go further to stop Russia's aggression, including an oil embargo, all of its banks blocked, and cutting off trade with Russia completely. U.S. President Joe Biden launching a new trade deal with 12 Indo-Pacific nations today, aiming at strengthening their economies, as he warned Americans worried about high inflation that it's going to be a haul before they feel relief. Biden says he does not believe an economic recession is inevitable in the U.S., though. Speaking at a news conference after holding talks with Japan's Prime Minister Fumio Kishida, he acknowledged the U.S. economy has problems, but that they were less consequential than the rest of the world has. And more from Biden's trip. He said today that the U.S. would intervene militarily if China were to invade Taiwan, saying the burden to protect Taiwan is even stronger after Russia's invasion of Ukraine. was one of the most forceful presidential statements in support of self-governing in decades. Biden, at a news conference in Tokyo, said, quote, yes, when asked if he was willing to get involved to defend Taiwan if China invaded. Biden reiterating that this was the commitment the U.S. made. The U.S. traditionally has avoided making such an explicit security guarantee to Taiwan, with which it has no longer mutual defense treaty, instead maintaining a policy of strategic ambiguity about how far it will go and how far it will be willing to go if China invaded. The 1979 Taiwan Relations Act, which has governed U.S. relations with the island, does not require the U.S. to step in militarily to defend Taiwan if China invades, but makes it American policy to ensure Taiwan has the resources to defend itself and to prevent any unilateral change of status in Taiwan by Beijing. And a military plane carrying enough specialty infant formula for more than 500,000 baby bottles arrived in Indianapolis Sunday, the first of several flights expected from Europe aimed at relieving a shortage that has sent parents scrambling to find enough to feed their children. President Joe Biden authorizing the use of Air Force planes for the effort, dubbed Operation Fly Formula, because no commercial flights were available. The formula weighed 78,000 pounds, according to the White House. Agriculture Secretary Tom Vilsack says he was there in Indianapolis to greet the arrival of the first shipment. The flights are intended to provide some incremental relief in the coming days as the government works on a more lasting response to the shortage. In sports, the Bahamas Davis Cup and Billie Jean King Cup teams for 2022 finalized after the Bahamas Lawn Tennis Association held trials for the final two spots for the teams over the weekend. Clinching their spots in the Davis Cup team were Kevin Major Jr. and Baker Newman. They will team up with Spencer Newman and Marvin Roll, who qualified at the Giorgio Baldacci Open Nationals in December. On the women's side, Simone Pratt and 16-year-old Sierra Rogers booking their spots for the Billie Jean King Cup team. They will team up with Sydney Clark and Alana Mackey, who also qualified in December. You can read more about the team members in today's Guardian Sports section. And the Bahamas' senior men's national basketball team will get a boost at the shooting guard position for its upcoming fixtures at Indiana Pacers sharpshooter Chavano Buddy Hield will play. He confirmed that he will suit up for the Bahamas in July. Hield making the announcement after tryouts for his Buddy Buckets Bahamas Amateur Athletic Union team this past Saturday. He kept it short when reporters asked him about playing this summer, simply saying, "Oh yes, I will play this summer." The last time Hield played for the Bahamas was in the third window of the 2019 FIBA Basketball World Cup Americas qualifiers back in June 2018. The Bahamas split 2 games. It's uncertain if the other two Bahamian NBA players, Charlotte Hornets' Kai Jones and Phoenix Suns' DeAndre Ayton, will play on the team this summer. The Bahamas are set to play in the third window of the 2023 FIBA Basketball World Cup qualifiers in July. They'll play against the U.S. Virgin Islands on Friday, July 1st, and the University of the Virgin Islands Sports and Fitness Center. That's going to happen there. The two teams met in February of this year, with the Bahamas beating the USVI 86-74. You can read more about this in today's Guardian Sports section. And from the NBA, the Golden State Warriors just one win away from the NBA championships, as they have now taken a 3-0 lead in the Western Conference Finals, beating the Dallas Mavericks last night 109-100. That's sports, and that's the overnight. Time for your first look at weather. In your first look at weather for today, high pressure remains across the islands, generating moderate to fresh breezes. Beachgoers should exercise caution due to the risk of rip currents along eastern shorelines. For all areas today, your forecast calls for mostly sunny, warm, and breezy conditions with a chance of a few light showers or thunderstorms, becoming variably cloudy and breezy with a chance of isolated showers tonight. For boaters, a small craft caution is in effect for the central and southeast Bahamas. Winds east to southeast at 10 to 15 knots in the northwestern islands and 15 to 20 knots in the central and southeast Bahamas. Seas 2 to 4 feet in the northwestern islands, but 4 to 6 feet in the central and southeast Bahamas. Temperatures today getting up to around 88 Fahrenheit, 31 Celsius. Overnight lows tonight getting down to about 73 Fahrenheit, 23 Celsius. That's your first look at weather this morning. We'll have your extended outlook coming up after traffic in just a bit.
Wake up, it's a new day.
You're listening to Morning Blend. When we come back, we're discussing the day's top stories right here on your home for fresh news and smart talk all day. Guardian Radio 96.9.
You know that it's the start of the end of the old way. Wake up, it's a new day. Wake up, it's a new day.
Switch for better when you move your mortgage to Scotiabank.
Leave behind that old mortgage plan and open the door to a low interest rate. No payments for up to 2 months and cash back of 2.5% of the mortgage amount up to US $10,000. And guess what? It gets better. Apply for your Scotiabank credit card and enjoy a low 9.99% introductory rate for the first 6 months. Switch for better and upgrade your mortgage today with Scotiabank. Offer ends June 30th, 2022.
Around the world, Cleveland Clinic is recognized as a leader in healthcare. Our team of experts relentlessly pursues the best for our patients. From groundbreaking cancer research to state-of-the-art heart surgery, life-saving innovations happen here every day. When it's time to travel for your health, it's time to travel to Cleveland Clinic. Your destination for care. For every care in the world. To learn more, visit clevelandclinic.org/Caribbean.
Tired of banks forcing you to use technology to bank the way they want you to? Your convenience is important. So no matter what your banking needs, Commonwealth Bank's friendly staff are always available in branch for that personal one-on-one service. But when you choose technology, our online and mobile banking app offers you state-of-the-art functionality. The choice is yours. Commonwealth Bank. Bank the way you want.
Technology serves to make our lives better, so why not your business too? At Custom Computers, we've been maintaining our knowledge and relationships with top tech companies since 1987 and carry only the most trusted brands like Apple, Microsoft, HP, and more. No company has helped more businesses build reliable IT systems than Custom Computers. You name it, we've done it. Call 396-1101 to talk to any of our business experts. Find trust in your tech. Count on Custom Computers.
I bank wherever I want thanks to Scotia Online and Mobile. I bank from my garden. I bank from my living room. I also bank from my kitchen. No need to wait in line. Now when I bank with Scotia, I bank on my own time. Seniors, you too can bank your way any time of day without ever going into a branch. Find out more. To get started, visit bs.scotiabank.com/digital seniors.
Wake up, it's a new day. Wake up, it's a new day. It's the start of the new way. You know that it's the start of the end of the old way. Wake up, it's a new day. Wake up, it's a new day.
Welcome back to Morning Blend here on Guardian Radio 96.9. We are streaming live on GuardianTalkRadio.com and on the Guardian Radio app for smart devices. We're also on your televisions on Cable Bahamas Channel 969 and BTC Flow Channel 612. You can tweet us at MorningBlend969 or Facebook.com/MorningBlend969. Text us on the Guardian Radio text line powered by BTC 422-4796. Standard text rates apply. Once again, I'm Dwight Strachan. Guess what? Pamela Musgrove is going to be joining us. I thought she was still on vacation, but she's coming back. She's coming. She's going to be with us any minute now. So I'm looking forward to that. And we'll give you the phone numbers to call in just a bit. Coming up this morning in our 8 o'clock hour, we're going to be talking with Doctors Hospital. They're teaming up to enhance their LAMP program. If you don't remember what that is, we'll get a refresher on that as well coming up in our 8 o'clock hour. In our 9 o'clock hour, we're going to be talking with the president of the PMU, the Public Managers Union. They've been having some major issues with NIB. We're going to get the very latest on where things stand and what that means for the National Insurance Board coming up. But we do have a lot to talk about this morning, and let's get to it in the news. And in the news, Carnival over the weekend, it looks like a lot of people took part, and looks like they had some fun. So good for them, and that's a encouraging sign that we are heading back to normal. And we're gonna keep our fingers crossed that everybody was safe and that we won't see anything come out of this. You know what I mean? Yeah. But yeah. And did you watch it on Friday? Shark Tank, Bahamian entrepreneur getting what a lot of people on Shark Tank can't get, the sharks to invest in their companies. And there's more on the story in today's Guardian Business section. So Alexio Gibson is his name, the 34-year-old. His company is the Transformation Factory, and they do sea moss, and they're taking sea moss, which many Bahamians swear by, taking it to the world. And a great episode on Friday night. And again, you can read more in today's Guardian Business section on that. So that's the good stuff. Then there's monkeypox, which is terrifying. And we're going to find out if they're already reporting in the U.S. I think I heard this morning in Florida as well. So something else to be concerned about. And the baby formula shortage in the U.S., we're trying to figure out if it's affecting the Bahamas. Hopefully we'll get some information about that soon. So there's so much going on. And then this headline in the Nassau Guardian today. We knew we got the statement from the PHA that they were having issues, bed shortages, but it is definitely a crisis situation. Our Rachel Scott writing about it today. With Princess Margaret Hospital operating at maximum capacity, consultant surgeon Dr. Loxley Monroe says that the healthcare system is challenged by patients who were unable to have elective procedures done during the pandemic. He said, to quote, people who ought to have had things done in 2020, they are now in a much worse position than they were in 2020. 2022, I guess he's trying to say. Oh, and in 2020, yes, sure, of course. Quote, therefore, you are looking again at your resources being outstripped because patients who may have had a hernia that was able to be reduced, that hernia is now incarcerated or strangulated. Someone who may have had a stage 1 cancer because of no access, they're now at stage 4. Someone who needed to have an endoscopy done couldn't get it done, and therefore, whatever that problem was, it has advanced. That is part of what we're looking at now. The conditions they have They have progressed during the time when they were more afraid of COVID than their condition. Now their condition has advanced, so basically they are in serious problems. And the system, given the deficits and given the ongoing problems with COVID, it still cannot facilitate their care in what would be considered a standard manner. Well, last week, the Public Hospitals Authority announced that the PMH was operating at maximum capacity as a result of non-COVID patients accessing care at the hospital. PHA said that as a result of decreased bed capacity, 40 patients at the hospital's emergency room were awaiting admission on Thursday, and that non-COVID hospital operations, resources, and services have been adjusted. The PHA said face-to-face outpatient services, including elective surgeries and specialty clinics, were limited. And the authority also said the PMH Family Medicine Clinic at Agape House was offering limited services as nurses were being redeployed to PMH. 23 more beds were expected to be added to the capacity by Friday. At numerous points during the past 2 years, the hospitals had to cope with overwhelming numbers of COVID patients, resulting in the postponement of elective procedures. Monroe says the lingering consequences of that are serious. He said any number of persons who had appointments for October of 2020 and could not get through, they have problems. He says, quote, if you really look at the statistics, and I guess that would be based on the government's census or whatnot, you would probably notice that the death rate has changed for certain things simply because of 2 years of inability to access care, and now you're into the third year. The consequences are not just for those who were dying from COVID, it's those who cannot have access to care because of the problem that you're facing. Monroe says some issues at the hospital were present before COVID, and the pandemic has brought them to the forefront. The institutions have all been operating above capacity from before the pandemic, he said, and the pandemic has simply exposed the fact that there is a huge deficit in the system. Wow. Pamela Musgrove joins us now. Pam, let's get your mic. There we go.
Good morning, Dwight.
I thought you were going to still be on.
Yeah, I thought it was 2 Mondays.
Oh, so you didn't even know how long you were off for. That's what you told me, too.
I thought it was 2 Mondays.
It's a pleasure.
Apparently it's only one.
We can never have enough time with you, so we are very happy to have you back with us. Hope you had a great time.
It's good to be here.
You've come back to lots of drama in the country, as always, and this is very disturbing. And we knew, I guess, I don't know if we thought about it much, but of course there would be consequences for a lack of elective surgery.
Yeah.
And here we are.
Persons were talking about it during the pandemic.
Yeah.
I think we've had for some time a healthcare crisis. And I think what the pandemic has done, it has shown the light brightly. We always knew we had challenges, but it's shown it brightly on our health crisis.
Yeah.
And I think what has to happen in healthcare, like with many other areas in our country, we need to do an audit and we need to address the issues.
Yeah.
An audit, be transparent. See, because when we hide things from the public or we act as if certain things don't exist, then we don't generally address them. But I think there needs to be an audit and make it public and address the issues that we are having one at a time.
Yeah, wow. Let's get your reaction to it, folks. I mean, people have been saying it, noting that for 2.5 years now, the obituaries have swollen. And, of course, many were assuming that was COVID-related, but a lot of this was not.
Yeah.
And
it was happening before.
Yeah. And people were ill, but they didn't have COVID, and they couldn't get the help they needed. And we've lost a lot of people in these 2 years to many, many, many things. Let's hear what you have to say, your take on this. 323-6232, 325-4316, 325-4259. Tweet us, Facebook us, text us, 422-4796. Let's get to some of your text messages, then we get to your calls. This person says here, what is, quote, many, unquote? Couldn't someone report, quote, we have 100 people who applied for surgeries in 2020 and had them canceled due to surgery. Out of 100, there were 30 cancer patients. 5 of them have worsened significantly due to the lack of care. Couldn't we report that? Well, we haven't had that significant. That goes back to what you're along the lines of what you're saying, right?
Yeah.
In the audit, they haven't provided that information to us as yet, unfortunately. The texter goes on to say, "No, Dwight, you can't say the death rate changed because people didn't access care. You can suspect, but you have to prove it. Maybe all of them died from car accidents or COVID." Well, I think the doctor knows. And that's what he's saying, right? This is your cancer was a stage 1, and now you're back in the hospital, and in stage 4. He can tell what's going on, and they can tell you. Maybe they can't give you the numbers that you'd like, but they know what's going on.
And persons were told not to come to the hospital unless it's absolutely urgent. And I imagine that there were a lot of instances where persons weren't able to do screenings for cancer or other illnesses because of the pandemic. And so, like the doctor said, and like we have been saying as well, you have these things that just gets worse.
Yeah. The texture continues, I don't trust any doctor. I want data. Well, the doctors are giving the data.
No, I agree with the text to a certain extent. I don't like this thing where you
want the numbers.
Yeah, you have all the information and you feed us this information and we must just accept what you are saying to us. I think there needs to be divisions where this data is compiled and it's put out there so people can get to see exactly what's happening.
Yeah. Okay. This texture here, great show as usual. You know the COVID cases are going up after that road march, and we have a holiday coming up. Shake my head. And also you see monkeypox, man. Nothing looks good about that. Don't bring that cross here. Well, as long as people are traveling, anything is possible.
Anything. Look, I traveled last
That's
weekend.
right. Oh, God,
Yes.
Pam. And you're here in the studio. Where all did you go? See, this is it right
This
here.
is probably right here.
Oh, good Lord.
I traveled.
When did you get back?
Yesterday.
Oh, help
But
me.
I had to take a test to come in. I think they should stop testing. I agree with it.
You agree with Bahama?
Okay. I traveled to 2 different states within the U.S. And they're saying that the U.S. is not testing like that.
Yeah.
They're not. And then it dawned on me that, because, in the airplanes now, mask is voluntary.
Right.
It's not mandatory. So going over, I had my mask on, and I noticed that the stewardess didn't have a mask on, and I forgot about the law that was passed.
Yeah. Did you feel self-conscious wearing the mask?
No, I'm telling you now, it was natural because you had to wear your mask in the at the Independent Airport.
Okay.
And so I had my mask on.
Yeah.
In the plane, I had the mask on, but I noticed that the stewardess didn't have a mask on. So I'm like, okay. So as I departed the plane, I asked, I said, is mask mandatory? She says, no, it's voluntary. I said, oh, yes, I remember the law. So when we got into the airport.
And you flew into the States.
Into the States. Yeah. You're not seeing masks.
Yeah.
Maybe 1 or 2 persons that are wearing their masks. I didn't have to wear my mask at all.
Yeah.
Nowhere I went did I have to take a mask. And I'll be honest with you, I don't go with the mask thing anyhow, right? So initially when I got, like when it was a crowded area, I would put it on because I had to take a test to return home. And I didn't want the test to be positive. But if I didn't have to take a test, then I was just not going to at all.
Wow.
And then within the U.S., persons are not required to take a test to travel domestically.
No.
So that's why there's
Same.
no concern. No, that's why there's no concern about COVID. They're moving along with their lives as normal as possible.
Yeah.
Because you don't have to take a test to travel within the U.S. You don't have to take a test for work. You don't have to.
Yep.
And so people are getting back to normal. And I think we need to look at our numbers and we need to have our healthcare officials and our business person assessing these numbers because we didn't determine we didn't call this pandemic. And we're not going to be the ones to call this pandemic over.
Yeah.
And so we shouldn't be scrambling because Jamaica did it, because Aruba did it. They probably did their analysis and determined that this is best based on what's going on around the world.
Yeah.
And then we're going to follow behind them because we didn't do our own analysis about what's going on.
We always follow the leader, it seems, and often not us, right? This text It says, who's dealing with the crisis of PMH? Isn't the minister and the top brass from the Ministry of Health in Switzerland? Well, I am sure there are other capable officials still here doing the work and always doing the work. And when the minister, because ministers come and go, and they have to continue working. So, but we do need policy changes.
Yeah,
and that's what the minister's responsible
Investment,
for. Right.
staffing, infrastructure.
Yeah.
You know, preventative measures. There are a lot of stuff that will determine the level we are at in our healthcare system, and that's on a policy level.
Yeah. This text here, Pam, has been sent by your enemies to take you out, Dwight. I want to see your travel itinerary, see where you went and whether there have been any monkeypox outbreaks where you went, Pam.
Went to the South, where those people never did want it to wear the mask.
Oh, boy. All right. So we're all in danger here. Caller,
Not in danger,
no.
Dwight. You're not
Have
in
you seen the
danger.
pictures? That looks disgusting, doesn't it? The monkeypox stuff. I mean,
I
it looks,
saw it. Yeah, it's
oh,
just,
my good
yeah,
Lord.
it's-
You remember hearing about this when you were younger, right?
No,
But you no,
never,
Like we didn't think it
never.
was real. We thought that was
Never.
like a make believe
Never.
thing.
Never.
You know, somebody being rude.
It's one
Chickenpox,
thing
smallpox,
right
but
after
right?
the other.
You can't catch a break.
Yeah, and I think the pandemic, like what we're experiencing, because of the pandemic, a lot of things were placed on the side, not dealt with, and so now it's coming back with a vengeance.
My goodness. Caller, good morning. You're on the air.
Yeah, good morning, Dwight and Pam. How
Hi.
you doing?
Good
Doing
morning.
Welcome back, Pam.
Thank
And
you.
the welcome back mean you and Dwight owe me $6 for my plan. But not answering the phone right away.
Oh, boy.
Listen, Dwight, I didn't want to be an I told you so person, but I told them so. During the pandemic, Pam said it. We was telling them it didn't make complete sense to close those clinics because you had some people that were very seriously ill. Somebody closed the clinic. You understand me? If they needed to operate those clinics, doctors and nurses are frontline workers. It just so happened that this ain't that type of war like what's going on in Ukraine. It's a war, a medical war, but all of them broke off running, stay home, hide from everything and close the clinic.
Yep.
Well, all they could do was wear their PPEs. That's what those things are for. They could have had selective or elective surgeries on the most critical ones. We told them about it during the pandemic. Close the clinic for what now? The person who shut the clinic, you might as well say they contributed directly towards people like my ex-mother-in-law that is now laying down in the grave. Phyllis Taylor laying down in the grave because she started stage 1 cancer. And because the clinics were closed, she couldn't get her treatment and follow-ups on time. And
Right.
she's now 6 feet.
Wow.
So Dr. Loxley Monroe is quite correct in what he is saying. I don't know who just make these dumb decisions, Pam, when it comes to this country going forward. I don't know who does it. And it's really bad. In the hospital, you know, 2 ways of putting it. I attend the hospital 3 times a week, renal patient. The hospital needs to be washed, and they need to build a new one. That's the bottom line. As 3 years in, the competent authority them is telling the Bahamian people, wear your mask, sanitize. You can't go this way. You can't go to Kentucky. You can't go to McDonald's and stay in your house and all kinds of things. What did the government do? Nothing. Nothing. We always had a room problem in PMH. At least we could have been seeing somebody building an extra 100 rooms somewhere around that place to accommodate 6 people. But what is being done? Nothing.
Okay.
Anyway,
Wow. Sorry to
thanks for
hear
taking
about
my
all of
call.
that. That's very sad there, but thank you very much. Appreciate it. Wow. All right. Let's take another call. Good morning, caller. You're on the air.
Godly day to this Strachan voice along with you and Pam, Dwight.
Hi.
morning.
Good morning.
Before I make my points, Dwight and Pam, what I want to say, Pam and you makes radio, want to be listened to. You know what I'm saying? Because you all deal with situations in a immature and in an intelligent manner.
Immature and intelligent?
Right.
He meant to say mature. He wanted to say mature, right?
Mature.
Oh, okay.
Partly, man.
Okay.
Partly, I was thinking in a mature and a intelligent manner.
Okay, thank you.
I apologize for that. My mind was traveling.
Well, immature and intelligent would be innovative. That would be
mature and intelligent manner.
Thank you very much.
You're welcome. I would never do that because it's not so. What I want to say, right? Now, all of those people that were here during the pandemic, those medical people, we had those sick people. Why is it that the authorities did not encourage those people to stay and assess us because they know the people were sick?
To stay what, sorry?
To stay here and assess us with those people that were sick instead of having some die and their sickness turn out worse. That's not decent thinking. My other point is, right, the few years I had in school, I never believed in copying. What I want to find out, why is it that the ministers, right, who are responsible for this pandemic, controlling this pandemic in the Bahamas, why is it that they want to go behind other countries, do what other countries are doing? You look out for your people first. The thing is, nobody are dealing with the people in which cause us to be going through this pandemic. But when you go and copying behind other people, we never going to get the result in which we need here in the Bahamas. Our people, those that's in authority, they got to learn how to do the right thing for our people. Thank you.
Okay.
And y'all stay beautiful.
Thank you very much. Appreciate
You're
it.
welcome.
All right, let's take another call and we'll get back to your messages. Good morning, caller. You're on the air. Hi, good morning. Are you there? Did we lose you? Call us back. 323-6232. 325-4316. 325-4259. Tweet us, Facebook us, text us, 422-4796. Good morning. So does this mean that if I travel on Bahamas Air to the U.S. this morning, I don't have to wear a mask?
No. That's Bahamas Air.
You got to wear a mask to get on, right?
That's a local.
Yeah.
See, but international flights. Well, the international air.
Yeah, once you get to the U.S.
No.
No?
You don't,
What do you mean?
on American, on Delta, you do not have to wear a mask.
Okay, but once you get in
On
the
the
plane, on Bahamas Air, you still have to wear the mask?
Well, Bahamas Air maybe because the Bahamians are managing that, so maybe
Well,
on
maybe when you
Bahamas
get into
Air.
U.S. airspace, they can't tell you what to do anymore.
No. When you hit the plane for American or Delta or United or Southwest,
one's
whatever
forcing
flight,
you.
you don't have to wear a mask.
Okay. Well, once you land in the U.S., Bahamas Air can't tell you anything.
Right. Yeah,
so,
when you
right.
get off the plane,
Right.
you can.
Right.
But Bahamas Air may have the policy.
Oh, they go on to ask. So once I get into U.S. airspace or U.S. waters, can't take a mask off.
Bahamas Air may have as their policy because it's a local carrier that you must wear your mask at all times. Now, when you leave the plane, depart from the plane into the airports, you don't have to wear your mask.
You've come that far. You can see Fort Lauderdale from the plane, but don't argue with the flight attendant. Like, we're in the U.S., you can't tell me what to do. Don't do that.
Dwight,
Don't
no,
do that.
no,
Just
Dwight.
wait till you land
Why
and then
though?
take off.
Why?
But I mean, it's only a few more minutes.
Yeah, but why?
It's been 2.5
all
years.
the other air
2.5
carriers,
years. What's the big
why?
deal?
Why? Why?
Oh, boy.
Why?
We don't need any more arguments and fights. Have you seen all these videos? Every day is a mask fight. Come
No,
on.
you don't have to have a fight. We're just asking the question, if that's the case, why? That's all.
Boy.
I mean, they're free to do it if they choose because, it's owned by the government, so the government can set the policies. But why? That's all.
Well, oh boy. This one says here, tell that caller that complaining about the COVID regulations, that it's too early for PLP rhetoric. What now? I mean, is that what you got from that? I mean, you're asking he was asking why do we do what we did during, but we all did that. The whole world,
I understand.
unfortunately.
I understand initially.
Yeah,
I
it was very
understand. I have
sad.
no problems with that. I think after that initial phase and us continuing to do what we did back in March 2020, I think that's the challenge.
Yeah. This person says here, am I the only one who was sounding the alarm about the state of the hospital? Many of the wards are in disarray. Equipment doesn't work. Lack of empathy and care and professionalism. We need a new hospital and a new healthcare system. But brave them look the other way and put their heads in the sand. Well, I mean, come on now.
I think
Is that
people
fair?
have been complaining about the hospital for many years. And all of
This
what
goes
that
back
text
many
is saying,
decades.
people believe the same.
And
the
these
same
folks have not had enough time. I mean, right? They're trying to manage a crisis situation and to say that they've put their heads in the sand. No, they are trying to deal with where we are right now. Give them a chance. In 5 years, if we're still here, then you could say that. But it's far too early to be saying that. The governments of the Bahamas, previous administrations, have put their heads in the hand, have been kicking this can down the road. And we, the Bahamian people, have been complacent with this as well, right? And implicit. And we've complained when we've had to deal with it, when you have to go to PMH, but after you leave there, like, oh, I hate that place, I never want to go back. And that's the end of it. And
I think successive administrations have failed to invest in a lot of areas in the country. And then they think the solution is to throw more money at it. So you don't invest in the hospital, you don't invest in healthcare properly, but then you want to now persons to pay a healthcare tax without reforming. I have a problem when we want to increase fees without reform. Same thing we're having with national insurance.
Yeah.
You know, no, you haven't made the investment to make national insurance more productive, but you want to increase the tax. So you just keep throwing money after a bad situation without, like I mentioned, getting an audit, understanding exactly what's going on, making it public, and deal with those issues.
Wow. This person says here, I'm a frontline worker at a government clinic. I'm not sure where your caller was getting his info from, but my clinic was never closed. And to the best of my knowledge, none of the other clinics were closed during the pandemic. Well, they had some outbreaks and they were, right? So, but, I mean, you couldn't get all the services that people need. I mean, you've got cancer.
Yeah.
What are you going to do with these clinics? So it's been a very challenging period, definitely. Caller, good morning. You're on the air.
Good morning, Dwight.
Hi.
Good morning, Pam. How you
Good
doing?
morning. I'm good, thanks.
Good. Good morning, my Bahamas. See, Dwight, let me tell you the problem in our beautiful country. See, this is not political because I'm a man straight down the middle, and I believe in the Bahamas. I love my country. I love my Bahamian. All my life I pray to God. When I pray to God, keep me healthy and keep my family healthy. Thank God, be healthy. See, the problem in this country, we have a lot of greedy people in this country. Either they wait for us, the government, or get your one hospital and wait there. See, we know how this country runs. I don't mean in the financial sector, run around. All the laws are designed so the greedy section of black and white hawkish family can make all this money in this country. We know that we need a new hospital a long time. And we want to say in the show all the time, yes, we may need this one stadium doing and got a lot of baseball, but scrap that $300 million or $30 million and extend the hospital on the eastern side. Break that building down, that whole Ministry of Education. Plenty of space there. You can have helicopter land and park everything there. See, that's why I keep telling you, the motor school, they ain't checking for it. They ain't like me, they ain't like you, they like get you, and none of what they like. Because anybody who's swear religion to the Queen of Airs and stuff, that's why they do these things now. Right. And I can go on this one. Now, watch this now. They got a army tank or whatever they call it. Now, you think I'm trying for the Haitians, the Chinese, and the Americans, and the other people. They bring them to kill us. The real Bahamians. They can't get to the land in our country. What they didn't do, and that's why I keep telling you, I don't hate Brave with the Brave. I think he's a fair and honest person. Government, stop the talk. Time to take my call.
Okay. Oh, boy. And another call. Good morning, caller. You're on the air.
Stop the talk.
Caller, turn on your radio for us, please. Good morning. Hi.
Good morning, Pam.
Good morning.
Welcome back, Pam.
Thank you. It's good to be back.
Dwight, I am very much encouraged and in agreement with the sentiments of the previous caller. I believe that if we look at our society today, the numbers that has increased in this country, I think it is time that we do consider investing into a new hospital. Even if we keep the existing, I believe that we can put one further in the West that would cater mostly to, heaven forbid, for instance, an aircraft accident where we don't have to transport the persons from the airport all the way here downtown to get help. Then we should have a center down there with a trauma center and so on and so forth, where we would be able to take care of persons who live in, especially in the southwest side of the island, like the Key, all Fort Bay, Mount Pleasant, so on and so forth. I believe the time has come that if we're going to invest our monies, we should look forward to doing something such as this, because the space where PMH is right now, to be honest, is already oversaturated. I don't think there's anything much more that we can put in that area. I think the time has come that we should consider building a newer facility to take care of the increased persons that reside in this country, and in particular Nassau. And so that's just a thought for the day. Thanks for taking my call. God bless you both, and God bless the Commonwealth of the Bahamas.
Yeah, thank you very much.
We may need a new hospital, a new facility, but if we don't,
definitely
okay, we may need it, right? But if we don't address the reforms that are needed, we will build a new hospital, and it will turn into this old hospital.
Yeah.
Years down the road.
Under the previous administration, I think it was Dr. Sands, we had conversations about this before, but about whether it is really an entire hospital that you need there, or trauma centers, as that caller said, right? So maybe we need two, out west and out east, a trauma center, and then specialized centers for cancer, for pediatrics.
We need reform.
Right?
You remember when
really
we brought the team in? What were they called? What was the name of the team? We brought in to help when they set up facilities in the parking lot.
Yeah, right. I can't remember the name.
And even though it was in the parking lot, it ran smoothly. Right? We need reform.
Yeah.
And unless we address those issues, we could build a new hospital.
Yeah.
We could build new schools. We could build new everything. But it will go right back to operating the way the old one is being operated.
Right. It cannot be business as usual. Definitely not. A couple more calls before we have to take the break. Good morning, caller. You're on the air.
Yes, good morning to you, Dwight. Good morning to you, Pam.
Good morning.
Johnson. Good morning to the wider Bahamas. You said we are a nation abided by Christian principles and the rule of law. Speaking on Christian principle, both of you familiar with Luke 14:28-30?
Say what, and you have to tell me what it says.
Yes, it is. Suppose one of you wants to build a tower.
Oh, yeah, I know that one.
Sit down and estimate the cost.
Yep.
See if you have enough money to complete it, percolate a foundation, and are not able to finish it. Everybody who sees it would ridicule you, saying,
Yes.
This person began to build and wasn't able to finish.
Planning.
Right. And so if you take a moment and pause, and, we often use the expression as a tripod expression. It says that you must know where you are, you must know your past to determine your future, and you must know your present to plot your path into the future. And you also must know the past and the present to know how far you've progressed. So when you look at the entire Bahamas as to what it is we do, we run an ad hoc government. Yes, we have a statement of an estimate of what we could do in 5 years. We cry about the poor. We never have to, we always say, how can we make it easier for them to remain poor? We never have discussions on how do you grow the economy so they wouldn't notice the price increase, because their salaries would grow proportionately to inflation and other things attached. They would have reserves to carry them for 6 months, a year, 18 months. We say, oh, let's save on this, let's save on that, let's save on 2%, but when the growth for 7.5%, maybe as much as 30% if you look at the true figures of the impact. The point I make is that if you look at the entire Bahamas and ask yourself on any institutions in this country, can you actually tell me what the actual deficiencies are today so that we could begin to address a strategy of what we actually need to build and the actual cost now and the actual timeline of achieving that across any matrix in the country, education, health, energy, anything. We don't have it. Now, we talk about ministers coming and going. I agree. The 5-year celebrities, that's exactly what they're here for, 5-year celebrities. But conservatively across government and government corporations, we have as much as 40,000 individuals working. Some of them have been there for 40 years. Somehow, we take it for granted that the ministers come and go. What happened to the PS who's been there for, all the time? These are institutions that's running that actually should have and know these matrices to actually be able to inform the ministers or whoever it is that comes in and sits in the temporary post.
Right. Wow.
And so as a country, we must take them for a moment, and maybe this is an opportunity for us to pause and begin to look and have a real assessment of where we are, where we need to go, and then develop. You talk about was it that National Development Plan? That the National Development Plan answered any of those questions they asked? It don't.
Right. See, Alan, thank you so much. Appreciate it. All right, messages as we go to the break here. According to any law, once you are in another country's airspace, it means that you are in that country. Therefore, the laws of that country apply. So if I'm on Bahamas here in U.S. airspace, the U.S. laws as relates to the wearing of face masks apply. Okay. New prison before new hospital. Are we serious? This one says here, I know for a fact that 90% of the clinics were closed. Okay. And Dwight and Pam, from the speech from the throne, the government said they would build a hospital in Nassau and Grand Bahama. But as Pam says, we got to strategically do this sensibly, right? Maybe that is not the answer. Maybe it is trauma centers that we need, and turn PMH into a specialty facility. Perhaps they still would need an A&E, I'm sure. But maybe that's what needs to happen. We don't have a children's hospital. Maybe we need to have one of those, right? We need to have some places that specialize, but move that away from the trauma centers. Mm-hmm. That might be a better way to go.
What are our real problems today as we see them? Real, honest, with an audit. This is what it is. See, if I were a prime minister for just a year, I would do a complete audit of all of these areas and lay it on the table in the House of Assembly. This is the problem. And this is what we're going to try to do to fix these aspects of the problem.
Yeah. All right, we're going to take a break. When we come back, some other big issues in the news. A sex offender released, and everyone's being warned that he's extremely dangerous. What's going on here, folks? Is this a Twilight Zone? We're going to get into it after the break. This is Morning Blend on Guardian Radio 96.9.
You don't wanna hold it down. Tears in my heart when you're not around. King but his queen, only you wear the crown. Cause boy, I wanna hold you, hold you, hold you. I wanna be with you the rest of my life.
This is Guardian Radio 96.9 FM, Nassau, Bahamas.
Time for your first look at traffic for this morning, brought to you by RBC. For all of life's moments, there's one Visa Classic credit card. In your real-time traffic at this hour, we are, as usual, seeing heavy traffic on Milo Butler Highway from Fire Trail all the way up to Tawny Williams Darling Highway. That's the northbound lanes there. Gladstone Road also busy for you, but might be a slightly better alternate route for you, as traffic is not all the way down to Fire Trail in the northbound lanes up to JFK Drive. Blue Hill Road is busy too, though. From Soldier Road to Independence Drive, heavy traffic there, northbound lanes. But also near the junction with Carmichael, you'll see some congestion there, especially near the school in the area. Independence Drive, both directions seeing some heavy traffic, west and eastbound. And Soldier Road near the intersection with East Street, that's looking congested for you, especially eastbound on Soldier toward the intersection. Further up, Soldier and Windsor Place, and then Soldier on the way to the intersection with Village, Wolf, and Bernard Road. Seeing some heavy traffic there. Bernard Road is busy for you westbound, as is Eastern Road from San Souci up to Johnson Road. And then pockets along Prince Charles Drive. You're going to be seeing that westbound this morning. Carmichael westbound to Coral Harbor Road also busy at this hour. That's what we're seeing. Those are your hot spots. That's your real-time traffic and your morning blend traffic alert brought to you by RBC. Experience cashless purchasing power and chip and pin security with your RBC Visa Classic credit card. Manage your day-to-day expenses and apply today at rbc.com/Caribbean/Visa Classic. Time for another check of your weather for today, brought to you by BTC. We've got high pressure across the islands generating moderate to fresh breezes. Beachgoers should exercise caution due to the risk of rip currents along eastern shorelines. For today, for all areas, we're looking at mostly sunny, warm, and breezy conditions with a chance of a few light showers or thunderstorms, becoming variably cloudy and breezy with the chance of isolated showers tonight. Small craft cautions in effect for the central and southeast Bahamas. Temperatures getting up to around 88 Fahrenheit, 31 Celsius. Overnight lows tonight getting down to 73 Fahrenheit, 23 Celsius. In your extended outlook, we've got high pressure expected to remain across the area with drier conditions and fresh to moderate winds. For Tuesday, expect partly sunny, warm, and breezy conditions with a chance of a few isolated showers. Wednesday, partly sunny, warm, and breezy with a chance of a few isolated showers. In the tropics, yes, it's not hurricane season quite yet, but we're noticing some things. Surface observations and radar data indicate that an area of low pressure previously over the north-central Gulf of Mexico has now moved inland about 15 miles west-northwest of Pensacola, Florida. As the system continues to move further inland tonight, tropical cyclone development is not expected, but the system continues to produce disorganized thunderstorms and gusty winds across portions of Florida and the Florida Panhandle and the southern Alabama area. The activity is expected to spread northeastward across the southeastern U.S. over the next day or so, but formation chance through the next 5 days is low, hovering around 0%, just so you know. And remember, the Atlantic hurricane season begins June 1st. That's your morning blend weather check brought to you by BTC. Switch to BTC and get 2 months of free internet for new customers. Pay for the first month and get the second and third months free. Get the speed you need and get great savings on the Bahamas' best network. With BTC's fiber network, you can browse the web, enjoy social media, and stream your favorite HD videos. Visit a BTC store or call 225-5282 to sign up today. Conditions apply.
Even when dining out is kind of predictable. Will that be all, miss?
No, I would like that double-decker caramel chocolate cheesecake.
Sometimes you need to make a classic move. That's why for all of life's moments, there's one classic credit card. Experience cashless purchasing power and chip and pin security with your RBC Visa Classic Credit Card. Manage your day-to-day expenses. Apply today at rbc.com/Caribbean/Visa Classic and enjoy 1 year's free membership. Conditions apply.
Breakfast just got better at Wendy's. Introducing the Breakfast Biggie Bag. Enjoy a double sausage muffin with 2 square sausage patties, a freshly cracked egg, and cheese served on a toasted English muffin, a medium waffle fries, and an orange juice for only $5.25, VAT inclusive. Add an apple pie for just $1 more.
Say what?
At Wendy's, better breakfast is all day. Offers valid in participating locations. Wendy's, different inside and out.
You're always on the go. We know life can be a daily rush. CIBC, First Caribbean, you can count on us. We make life easier. Manage your accounts at any time. Apply for a loan. It's easy when you bank online. We make life easier with choices that suit you. CIBC, First Caribbean.
Wherever you're headed, the Custom Computers Know-How team is standing by to help guide you in the East and the West. We now have 2 convenient locations on Patton Street in Palmdale and our newest store in the Caves Village Shopping Plaza through the Blake Road entrance. Discover the latest products by top international brands and the knowledge you need to unleash tomorrow's technology today. Drop by Custom Computers out east or out west. We're open Saturdays from 10 till 4.
Earning zero interest on your savings at the bank? With as little as $100, you can start earning interest on your money while you're sleeping, eating, or standing in line at the bank with the CFAL Savings Express Plan. Ready to invest? Start by putting $1,000 into our mutual funds and earn interest there too. Because at CFAL, your interest is our interest. Visit CFAL.com to start now. CFAL, growing wealth for future generations of Bahamians.
This is Guardian Radio 96.9 FM, Fresh news, smart talk, all day.
Broken pieces scattered across the floor.
We're back here with Morning Blend on Guardian Radio 96.9. Dwight Strachan along with Pamela Musgrove. Oh yeah, I think we have the time. Do we have the time to get to that through that report? Yeah. We do? No, we don't? Okay, so we'll set up a tease. We'll play this after. We do? Okay, let's do this, and then we'll talk about it. So listen to this report. This is what has Pam and myself worked up this morning. This report from Friday from our Berthany McDermott.
National Security Minister Wayne Munro QC announcing that a man convicted for indecent assault will be released from prison Friday as he was deemed a significant public risk. 55-year-old Alden Scott was convicted for indecently assaulting a 9-year-old girl in 2021 and is on the sexual offenders registry following his release from prison.
Due to the antecedents, the criminal history of the offender, his conduct while in the correctional facility and while out working at a police station was such that they deemed him a risk of significant harm to the health and safety of the public.
Scott is 5'5", 165 pounds, and medium built. He has black hair and is of dark brown complexion. Scott was sentenced to 2 years in prison after he admitted to caressing the girl's thigh at her home on January 17th. However, that wasn't his first time in prison for insulting a female. Scott was previously sentenced to 9 years in prison for raping a 17-year-old girl, and according to Munro, while in prison he expressed similar behavior towards women. Now, Munro said he met with the offender this morning where he expressed two concerns: employment and the possibility of retaliation.
If that manifests as a reality, the learning is that it will lead to courts directing against public notification. And so if we want to continue for the public to have this tool, to know who is amongst them, who they must exercise care towards, it is very important that there not be physical retaliation.
The news comes a few days after a sexual offenders kiosk was placed at a local police station. Currently, sexual offenders sign in once per year and within 7 days if there is an address change. However, Munro feels there is a more efficient way.
The preferred protection in our view, as I expressed to the offender, is that you be electronically monitored so that you know, that I know where you are 24 hours a day, 7 days a week, 52 weeks a year.
Reporting for the Guardian News Network, I'm Berthany McDermott.
We've got to go to news. We'll pick this up. Remember everything you heard in that report. We'll talk about it on the other side. Stay with us. Welcome back to Morning Blend here on Guardian Radio 96.9. We are streaming live on GuardianTalkRadio.com and on the Guardian Radio app for your smart devices. We're also on your televisions on Cable Bahamas Channel 969 and BTC Flow Channel 612. You can tweet us at Morning Blend 969 or Facebook.com/Morning Blend 969. Text us 422-4796. And now at 8:19, time for another check of your weather for today, brought to you by Bahamas First Insurance. Here's what's happening. We've got high pressure across the islands generating moderate to fresh breezes, and beachgoers should exercise caution due to the risk of rip currents along eastern shorelines. For all areas today, your forecast calls for mostly sunny, warm, and breezy conditions with a chance of a few light showers or thunderstorms, becoming variably cloudy and breezy with a chance of isolated thunderstorms tonight. Small craft cautions in effect for the central and southeast Bahamas. Temperatures today expected to get up to around 88 Fahrenheit, 31 Celsius. Overnight lows tonight getting down to about 73 Fahrenheit, 23 Celsius. In your extended outlook, high pressure is expected to remain across the area with drier conditions coming and fresh to moderate winds. So Tuesday and Wednesday, you will see that partly sunny, warm, and breezy with a chance of a few isolated showers. In the tropics, we've got a little activity near Florida. An area of low pressure previously over the north central Gulf of Mexico has now moved inland about 15 miles west-northwest of Pensacola, Florida. The system continues to move further inland And tropical cyclone development is not expected, but the system continues to produce disorganized thunderstorms and gusty winds across portions of the Florida Panhandle and southern Alabama. This activity is expected to spread northeastward across the southeastern U.S. over the next day or so, but formation chance practically zero over the next 5 days. And a reminder, the hurricane season begins June 1st. That's your morning blend weather check brought to you by Bahamas First Insurance, still the first and only local insurance company and agency network that lets you buy car and home insurance 100% online. Try it at bahamasfirst.com. And at 8:21, time for another check of your traffic brought to you by RBC. For all of life's moments, there's one Visa Classic credit card. In your morning blend traffic, reminder about the work going on Village Road. Motorists and pedestrians being advised to proceed with caution as the work continues there. And there will be partial road or lane closures at times over the next few weeks. Construction works and equipment operating in the area during the day, and you're asked to avoid the area during peak hours when possible and seek an alternative route if you can. In your real-time traffic at this hour, Milo Butler Highway still seeing heavy traffic from Fire Trail all the way up to Tonic Williams Darling Highway, and we're seeing some lines at Tonic Williams Darling Highway both directions heading toward that roundabout as well. Gladstone Road looks like a better alternate route for you. Traffic just about midway between Fire Trail and JFK Drive at this hour. Carmichael westbound seeing some heavy congestion heading toward the Coral Harbor roundabout. And building eastbound to Blue Hill Road. Blue Hill Road is busy from north of Soldier up to Independence Drive, the roundabout there. Independence Drive, both directions, but mainly westbound. Heavy traffic on the way to that roundabout. Elsewhere, we've got pockets along Soldier Road, especially near Windsor Place, and north of Robinson Road on the way to the intersection with Wolf, Bernard, and Village. That's northbound mainly. Eastern Road seeing some heavy traffic just west of Camperdown now on the way to Johnson Road, and pockets along Prince Charles Drive and Bernard Road westbound mainly. Those are your hot spots. That's your real-time traffic and your morning blend traffic alert brought to you by RBC. Experience cashless purchasing power and chip and pin security with your RBC Visa Classic credit card. Manage your day-to-day expenses and apply today at rbc.com/Caribbean/Visa Classic.
Thank God it's Friday, no working till Monday. My bikes are back, going back to the family islands.
Oh my, that's a hurtful song there. It's Monday. I guess we can look forward to Friday for that. Okay, all right. Welcome back to Morning Blend here on Guardian Radio 96.9. Dwight Strachan along with Pamela Musgrove. Coming up in a few minutes, we're going to be talking with Doctors Hospital. A lot of exciting things going on with them, their lamp services, and they're launching some new locations. Doctors Hospital coming to Carmichael Road today. So, yeah, we're going to get into that this morning. And later in Morning Blend Business, we're talking with the Public Managers Union about their issues at NIB. Okay, so before the break, we played that piece for you about A sex offender who's being released and the public being warned about this. And there's more in today's National Guardian about it. Jasper Ward writing about it. Again, we'll just quickly go through this and then get your views on it. 55-year-old sex offender released from the Bahamas Department of Correctional Services on Friday. The man, identified as Alden Scott, who has been added to the sex offenders register. Scott was sentenced to 2 years in prison last year after he admitted to caressing a 9-year-old girl on her thigh at her home. Prior to his sentence, Scott had been released from prison for raping a 17-year-old girl, for which he received a 9-year sentence. Now, National Security Minister Wayne Monroe said Scott has been deemed, quote, a risk of significant harm to the health and safety of the public, as opposed to a particular individual. He said prison officials advised him to alert the public of Scott's release. Monroe at a press conference on Friday saying, quote, this is an offender who has shown no age preference in victims. His history shows offenses against a child of 9, a young woman of 17, and while in the correctional institution, behavior towards adult females. The registrar of the sexual offenders list and the commissioner of the correctional institution deem him a significant risk to public safety. Monroe saying, quote, I have viewed their submission to me. I have heard the offender, and I have advised that he is a significant risk to public safety. He's also saying that, and he has been released amongst us. Monroe said Scott will not be electronically monitored because the law does not allow for it. He told Scott that he prefers for him to be electronically monitored, quote, so that you know that I know where you are 24 hours a day, 7 days a week, 52 weeks a year. Monroe said notices with Scott's photo will be published to alert the public. He said there are concerns about retaliation, though, aimed at Scott following his release. He says, quote, I make the public to be fully aware that if that manifests as reality, the learning is that it will lead to courts directing against public notification. If we want to continue for the public to have this tool to know who is among them and who they should exercise care towards, it is very important that there not be physical retaliation. It will lead to a case being properly made that there's a real and present danger to notification with intended results. So this is the first time that there will be a public notification, and the public is advised that the history of how this happens will determine whether it goes forward in this effect. Section 13 of the Registration of Sex Offenders Regulations 2019 requires the Minister of National Security to give public notification of the release of an offender who poses a significant risk of significant harm to the health or safety of the public. And that is where we are. Okay. Wow.
I have several issues.
So many issues.
With this story. Okay. So, this man was charged and convicted for rape, and he got 9 years. I wonder if he served the full 9 years, or you know if he served the full 9 years.
I don't know.
Okay, and so then he.
But as we heard
admitted
before, a year, unless it's drugs and guns, a year is not a year.
But I mean, he would have served whatever time.
Served some time.
Yes,
yeah. Mm-hmm.
that he was supposed to have served for the offense, and it is stated that he admitted to caressing a 9-year-old, and he got 2 years. First problem. Now, any parliamentarian, any minister of national security should look at that and see that you need to go back to Parliament and make the law stiffer for someone who is convicted of rape and to be in this situation. Their hands are not tied, Dwight, to make this change.
Yeah.
You can do it in Parliament. Then Mr. Monroe said that Mr. Scott will not be monitored electronically because the law does not allow for it. Where does Mr. Monroe sit? And what is the primary role of a parliamentarian?
Well, we thought it was to make laws.
And amend laws. Right? And so this is my concern. It's like, I get the impression that Mr. Monroe does not like this sex offender list being out there from this story.
Yeah, sending this warning to the public not to do anything to this.
If something happens to him,
significant threat to
then
public safety.
we wouldn't do this again.
Right. And
That's the impression I got. And I think what we need parliamentarians, and this is where I went back to initially the audit, knowing exactly what the problems are and really trying to address them. I get here that we're avoiding trying to address this issue because this is not hard. If you see that someone was charged for rape, but then they turned around and did something like this to a 9-year-old, which means there's a possibility that they can do something more serious, then you need to adjust the law.
But also,
amend the law.
while he's in prison, he's doing things and saying things to women as well. And yet, he's still a danger, but we got to let him out.
Yeah, but then
I have a major problem with that.
But there should be a system where this would be added to his file,
right?
So that when he was upon release, he go back to the court and said they would say, I don't think he should be released because of these incidents.
Absolutely, he needs more time because he's not reformed. He's still a danger, and we're going to get ourselves into big problems.
And then the other problem I have is that he is saying that prison officials advised him that Scott is a risk to the public.
Yeah.
I don't think prison officials should be the one doing that. I think there should be a parole type board set up to assess these persons to determine whether they should be they should be on the list, because according to Mr. Monroe, not every person who's charged with a sexual offense will be on this list. I don't think prison officials and the minister should determine that.
Right.
I think there should be a more objective board. And then I have this issue here where he said the Register of Sexual Offenders list and the Commissioner of Correctional Institutions deemed him a significant risk to the public safety. Then he said, I have reviewed their submission to me. I have heard the offender, and I have determined that he is a significant risk to the public safety. There's a lot of I in here. This sounds to me like Nebuchadnezzar. But I don't think that the minister should be determining this.
Oh, well, we got a lot of laws that allow for that, Pam.
I don't think so. There needs to be more of an objective body to determine this.
Right. A parole
As
board,
opposed to-
the prison officials
too
make
much
their
I in
case.
this.
Everybody else make their
Yeah.
case. This is what he did. We don't think he should be released, even though the time is up. This is a danger to our society. What say you, though, folks? This is the law, right? Oh, boy. Let's get your views. 323-6232, 325-4316, 325-4259. Tweet us, Facebook us, text us, 422-4796. Caller, good morning. You're on the air. Hi, good morning. Good morning.
Hello.
Hi, yes, we can hear you.
Hi, yeah, good morning. Dwight, I just want to, if you don't mind, sway a little bit from the topic.
No, we really can't. We don't have the
Well, I
time.
say it's very important.
Uh-huh.
The CDC released a warning or recall about Jif peanut butter and the danger of salmonella poisoning.
Yeah.
And I'm not so sure if our health officials have addressed that in this country.
No, it just happened, but hopefully they will, and we will talk about it more in the business report as well. But thank you for that, and I hope people hear that and try to get more information about that. But you'll hear a little bit more coming up in our business report. But it is breaking development over the last few hours, actually. So we'll pay attention to what's going on there. There's certain ones that are being recalled. Right. All right, let's take another call. Good morning, call. You're on the air.
Good morning, Dwight.
Hi.
And good morning, Pam.
Good morning.
Yeah, I like the way you break that down, Pam. I couldn't have done a better job as a former policeman. I have so many questions about that because no minister should be in any position to determine when one should be released from prison. Under no circumstances, you are absolutely correct that the fact that that parole board, that board is comprised of many different persons from different parts of society. Well, that should make a definitive decision based on the information they receive from the various bodies as whether this man posed a risk the security and should not be released at this time. The matter should be referred back to the court. We should put mechanism in place, and the law should be revised to make sure that when any such person is released, they are properly monitored in the interest of the public. This is just obscene that we could be doing this in 2022.
Yeah.
All right, thank you for taking my call.
Appreciate it. Let's take another call. Good morning, caller. You're on the air.
Good morning.
Hi.
Good morning.
Listen, I am trying to wonder about the monitoring of the gentleman. Couldn't they put an ankle bracelet on him because they know that he is definitely a risk and a danger to the public? Couldn't they made it mandatory that, okay, if you really want to be released, seeing that your time is up, but you would have to wear this ankle monitor? Couldn't they have done something like that?
Well, he says it's against the law. He says the law doesn't allow for them to do that. A person who served their time already, he's not out on bail or anything. He's finished. But they still deem him to be a threat.
Yeah, but they can amend the law.
They themselves see where this gentleman is has no indication of rehabilitation and probably don't even care. So then you just gonna let him loose on the public, tell us that he is loose, and then warn us against any physical danger. I mean, that makes no sense. That's literally like turning on the pot and dropping the crab in their lives and say, look here, don't worry about this thing will hate you.
Well,
in the environment that we live in today, I love to see some retaliation. I'm so sorry, but I have a feeling that will happen because I have a 16-year-old daughter, and so help me God. You understand me?
Yeah.
I have brothers, I have friends and families who ain't gonna tolerate him coming around doing that. So I think they should, for his own safety, if not for the public, for his own safety, if they truly want him to remain alive, I think they should secure him more better than that. That's not fair to the public, and it's not fair to him because you literally putting him out there and put the big tag on him and say, here I am, get me.
yeah. Thank you very much. Appreciate it. Well, this represents a complete, in my view, failure of this department. It is called now the Bahamas Department of Correctional Services, and you see that somebody is absolutely not reformed. They are as much a danger as ever before, and you're like, oh, well, what can we do? This is insane.
I think one argument would be that he has served his time. But if he was doing stuff in prison,
absolutely,
there should be a mechanism where that will result in time being added once he goes to the court.
Why didn't that happen? Right? This makes no sense. No sense at all. Continue to call us 323-6232, 325-4316, 325-4259. Tweet us, Facebook us, text us 422-4796. Let's get to some of your text messages here. And I mean, that crazy warning to us, right? Don't do anything to him because then we won't be able to tell you anymore.
Because I don't get the impression that they want this to happen. Well, the minister wants this to happen. So
the safety of one or two over the public, that's much more important.
It's like putting a bag of candies in the front of a child, a 5-year-old, and say, if you eat any of this candy,
you'll shut down the factory?
What do you expect?
There'll be no more candies ever in the whole country. Okay. Someone says here, I'm wondering if pastors, government officials, and prominent members of society will be placed on that list, or is it just from people out of the ghetto? That's a text. Okay. My goodness gracious. This one says here, Dwight, the person who is coming out and is a sex offender with the temperament of the people in the country today, and pokey them, killing with no remorse, that sexual offender, if he knows what's best for him, he better behave himself, or he might have a very, very short time left. Okay, anyway, I'm not going to read the rest of that one there, but... Oh boy, a defense lawyer trying to enforce the law when he's been on the opposite side for his career. I keep saying Monroe was the worst choice for a national security minister. It's like making a bank robber in charge of the bank. That's text, folks. This one here, I think Monroe is correct. The only thing I have a problem with is the announcement that the prisoner was released. I'm iffy on that. Really? Okay. It's almost like putting a target and hoping the man gets attacked. Criminal justice says you commit a crime, we charge you. You serve your time, and that's your punishment. The system does not say after you serve your time, we have the right to give you continued punishment until we're satisfied. If the problem is the length of the sentence, we don't feel you got a severe enough punishment, it will change the law. Yes, and that's what Pam's saying. We're all saying that. Just that. But
this is a way to protect persons because of the crime that he's committed.
let me tell you, if this were any other place in the world, if a sex offender was released and nobody knew, people would sue.
Yeah.
People would sue and would win. Here,
I mean, I'm not sure that for every sex offender added to this list, this would be done. Where you have a press conference and you put the picture of the person out there. I'm not sure that's appropriate. I think they don't want to do it, and so that's why they're doing this, because there could be a list that's online that you can have the picture and you see it, but to display it like this, I'm not sure if I agree with it in this manner, and I'm not sure that they're going to do it for all of them.
Right. Well, they must be really afraid of this one. This one says here, as a law-abiding citizen, I'm so sick of Minister Monroe. Please, Prime Minister Davis, address the laws to deal with these criminals. I'm sick of Monroe and his lack of active solutions. Wow. Another text here. I think it's a step in the right direction. Before that, these people were being released, and the only time we found out was when they committed another offense. Yes. What are you guys complaining about? We just wait for 5 years for the next government to fix it. Well, they won't. They won't fix it. They'll talk more and talk about whatever they can talk about, but nothing gets fixed.
Yeah.
Nothing. Yeah. Caller, good morning. You're on the air.
Hi, good morning. How are you?
Doing well.
That's good. I believe this is a setup. I believe the police, they release him. They know that he's going to be killed. Okay? That's what I believe.
Oh, boy. Okay. All right. Thank you very much. Appreciate it. I know everyone's thinking it, but let's try not to I don't know. It feels kind of... No?
And if something happens to him, they wouldn't release any others.
Yeah. And
that's what we're being told.
Boy, oh, boy. Caller, good morning. You're on the air.
Morning, Dwight. Morning, Pam, again.
Good morning.
I think this is a very dangerous precedent that's being set here. The danger here is that the general public is in danger if what is being alleged here happens to be the habit of this individual. Heaven forbid that this person actually, and I'm now going to carry it more to an international level, where something perpetrates against a foreign national residing here in the country. Could you imagine the advisories that would go out against this? Could you imagine the advisories that's perhaps already gone out because this precedent now is being set here? There has to be, Parliament is charged or the government is charged with amending the laws. And I think careful and thoughtful consideration need to put forward in this matter, because I already see perhaps, and like I said before, heaven forbid, that something outside of our reach, our realm, actually occurs against a foreign national here, i.e. the United States citizen or something like that, or a British citizen, and we have an international incident now being placed upon us as Bahamians. I think we as Bahamians really need to take this matter very seriously. Thank you for taking my call this morning.
All right. Thank you very much. And that part about the sex offenders only required to check in once a year, was it? Oh, my goodness. Boy, oh, boy. Let's take this call, and then we'll get through your text messages, and then we've got to take a break. Good morning, caller. You're on the air. Okay. Let's go to the messages here. Wayne Monroe did and said nothing wrong. The only failure appears with the judge who gave him 2 years. In addition, was he charged for what was said to have been done in prison? Well, that last part, it doesn't seem so. But again, the judge's hands are tied, right? Because of the laws that our lawmakers are not adjusting or amending.
Yeah.
They're talking about everything but fixing these laws, and that is a problem. So it goes back to the government, to the cabinet. This one says here, unfortunately, Wayne Monroe appears to have a compassionate heart towards convicted criminals. What kind of banana republic are we running, allowing a sexual predator to be loose like a goose? In a situation like this, the individual is deemed unfit for society, and that is when the death sentence is warranted. Oh, boy. Okay. Another one here. Based on the tone of the statement and his handling of the public outrage of rape, it seems to be washing his hands like Pilate and standing at a distance and saying, "See him there." Well, oh boy, folks, let's not encourage this type of anyway. Dwight, please make a public announcement. Okay, that's back to that the CDC and Jeff. Yes. Dwight, criminals will thrive under this system. I'm editing here. We are protecting criminals. I've edited that one a lot there so as to not accuse somebody of something. This one says here, I think we are heading down a slippery slope if we don't get to the heart of the problem, which is the law. There are many individuals who serve their time and are still a threat to society. Murderers and thieves are released on a constant basis with the mindset still bent towards crime. We must address the law and sentencing of individuals for their crimes. This creature did his time, according to the law, and that's what needs to be addressed, yes. Well, you see, going back to what you said, Pam, if the minister is the one responsible for determining all these things and has to meet with all these people, when will he have the time to address the law? I mean, that's going to be a lot. And that is crazy.
And he was charged with rape, and he was convicted and charged for another offense. May not have been rape, but then what we need to do now is go back to the law and to make it even more stricter or to increase the penalty for somebody who has been charged with rape, serve their time, and commit a similar offense.
Yeah. This person says here, Dwight, the minister should not be the one to determine who gets on the list. It should be a certified mental health provider who can go to court if they have the minister. If they do it like this, the minister sounds like a narcissist with all of them. And just like what Pam says, like Nebuchadnezzar. This person says here, why are the women in this present administration agitating for stiffer sentencing and an effective sex offender registry? Okay. Does it have to be just the women? But sure. Yeah, that's a good question. Fine. This one says here, here's the thing. If something happens to him unrelated to his sexual offense, then we will still lose the registry because it would have been assumed that it was retaliation. That means the public is required to keep him safe no matter what or else. Yeah, let's put him up in a hotel. Let's keep him well fed so he doesn't have to do anything.
Keep him protected.
Let's keep him protected at all costs.
So we are allowed to have our sexual offender registry.
Oh my goodness!
That's our homework.
This is special times, folks. Keep our criminals safe. They deserve the best.
If we want to continue.
If you want to know if you are safe or not, right? Treat them well.
Yes.
So that you can be safe.
Yes. Or you can feel safe.
You can feel safe. Don't forget. One final call. Good morning, caller. You're on the air.
Hi, good morning.
Hi.
Good morning.
I don't know if anybody thought about it, but have we realized that the majority of the persons that are elected to represent the country are lawyers?
It's been that way for decades, yep.
Who their job before getting in there, the ones who get these persons for and out back on the street.
Yes.
It's amazing that they still can't get the law to adjust the suit because they're not going to make it harder for them to get their their clients released.
Mm-hmm.
And this is why people are working against us. Because in a way, they're going to make it difficult for them to get their clients out of jail or out of a situation. And if they amend the laws, it would make it more difficult for them. So because they know they have a life after public life, so they don't want to have their client in a position where they can't free them from any and all that pops up against them. Because for me, I am threatened. I am more threatened by a rapist than I am by a murderer.
Wow.
Because most murderers, they have a target, and they target their person. So I'm not one that lives in those circles, so I'm not afraid of them.
And-
However, I'm feeling very threatened for me and my daughter, but knowing that this man is on the street.
And caller, see, when you have a lot of men, I don't think a lot of times they see it that way. I'm not saying it's absolute, but I think for some of them, they don't see it that way, that you are more threatened by a rapist than you are a murderer.
Yes, yes.
And that's what I think the
that-
challenge is. And these are the
Yes.
persons who, in large majority, are setting the laws.
Yes, and the few women we have there seem to be silent and go along with, I guess, whatever whatever they say, they goes along with it, rather than standing up and speaking out and say, no. You know, we have women and children. We have girls that walk to school every day who don't know what this man look like, you know.
Yeah, there's a 52-year-old man who caressed, he's 55, but at the time he's probably 52, 53, who caressed a 9-year-old daughter, a girl.
So who's to say he's not going to pick someone
Okay.
child up off the street? Because these children see his picture, and I don't know if you recognize when you look at someone's picture and see them in person, it doesn't always look like the same person.
And he got a measly 2 years for that, after raping somebody.
Exactly. So, in all fairness, we have a lot of young girls that walk here. Age is no thing for him. He don't seem to care. You understand? And they don't seem to care. And these are the persons we stood in the hot sun for the line to elect.
My goodness.
Yep.
Yeah. Thank you very much, caller. Appreciate
Well,
it.
I guess that's why a lot of persons wanted to try the doctor out because of all the lawyers in the past, but that was short-lived.
Oh, boy. All right. We're going to take a break and be back. This is Morning Blend on Guardian Radio 96. Stay with us.
We're good for you. We know how important collecting your money can be to the success of your business. Start your relationship with Fidelity today so that we can show you the many options available to you with our merchant services. From click and pay options online to merchant terminals and e-commerce options. We're here to help your business succeed. For more details, speak to one of our business development officers at 356-7764 in Nassau or 352-6676 in Freeport. Visit our website at fidelitygroup.com or visit any of our branches.
Are you ready, kids? Poli's Playhouse presents Poli's Pop-Up Party. Your friends, Poli, Baby Shark, Coco Melon, and Charlie the Bird will be there with kiddie games, bouncing castles, face painting, food, beverages, and so much more. Showtime, 3 p.m. Saturday, May 28, 2022 at the William Thompson Auditorium at Bahamas Baptist College. Gates open 12 until 6 p.m. Tickets, $10. Sold at Snatch and Go, East Street South, or contact 544-1510 or visit the Instagram or Facebook page.
Screws and Fasteners World, Balfour Avenue and Palm Beach Street, has those hard-to-find fasteners for you right now. You can find stainless steel regular hex, carriage bolts, galvanized bolts, threaded rods, nails, self-tap screws, sex bolts, anchor bolts, turnbuckles, masonry tools, hand tools, and weed whacker strings. Check out the rope selection and car body fasteners, too. Special orders are welcome. It's your #1 fastener store. Screws and Fasteners World, Balfour Avenue and Palm Beach Streets. Call 326-1976.
This is Guardian Radio 96.9 FM, Nassau, Bahamas.
We are back here with Morning Blend on Guardian Radio 96.9. Dwight Strachan along with Pamela Musgrove. We're changing gears now. There's a lot of exciting things happening with Doctors Hospital, and I'm here to tell us all about it. We are very pleased to be talking with Rashawn Simonet and Marissa King. Good morning to you both.
Good morning. It's happy to be here.
Good morning.
All right, so let's begin with Doctors Hospital and Carmichael Road. That is beginning today. Marissa, I guess that's you, Marissa King. Tell us about that. What's happening? What can we expect? And give us all the details.
All right, so at Doctors Hospital at Jamaica Road, we're open from 7 a.m. Yeah, Mondays to Thursdays. Also, what we did at Doctors Hospital, we wanted to bring not just quality healthcare, but convenient healthcare. So we heard the person heard we brought Doctors Hospital in the inner community so that it's more accessible to, find it kind of difficult to move all the way to College Avenue. So basically, at the Carmichael Road Clinic, as well as Melbourne Clinic, it's just a smaller version of Doctors Hospital. However, you can get all of the services there as you would have got or be able to get at the main Doctors Hospital at Collins Avenue. Also, we're offering, just for a time being, a free COVID test with any of your lab tests that you get, and it's going to be valid for a month after your lab tests are completed.
Okay, all right, wonderful, wonderful. As you said, making it more accessible. We were talking about that earlier, about the need for more of these type of services in other parts of the island where the population is. Okay, so where exactly on Carmichael is it?
Yeah, so it is, Doctors Hospital in Carmichael is located in the plaza where you have Cash and Grove and Bahamas Up. So we're right there on Carmichael Road.
Okay, all right. We were having a challenge hearing you before. Okay, so that's great. Okay, for those who aren't familiar with with Carmichael, where exactly is that? Give us some other landmarks so we can reference it.
All right, so we're right next to Temple Fellowship Church. Well, you know what? We're right down the street from Popeyes. We're on the same side as Popeyes. So we're like right there. So when you see Popeyes, we're like two buildings down.
Okay, that's going to help a lot of people there, definitely.
So basically, you're opening a clinic. Is that?
Yes, we have a full-fledged clinic here.
Okay.
We offer different services such as lab work. We offer rehabilitation services. We offer specialist clinic. So just like they said, what you can do at the main Doctors Hospital, you'll be able to do at this location as well. It's just that we wanted to make it more convenient for persons, especially ones in the inner communities, or persons who just, don't want to drive all the way up there. So, like I said, we're not just promoting fast healthcare now, but we're also promoting convenience. We also cater to our self-pay patients as well as our NHI patients. So persons who are signed up under NHI can come and actually get their lab work done with a click of a finger, and it's very easy. You can just come in, let us know what it is that you want to do, and we take care of the rest for you.
So will you accept walk-ins?
Yes, we do accept walk-ins, most definitely. Mm-hmm. So you don't need an appointment to come into Doctors Hospital at Carmichael.
Wow. All right, so this is great. So you've got lab and rehab services beginning today, and next week, the clinical care services. Is that right?
That is correct.
All right, so tell us more about that, what that includes, clinical care.
Well, we'll have various physicians that will be stationed here. I'm not sure of the names as yet. However, we will have physicians stationed here so that if you're just saying, if you had a sprained ankle or experiencing some chest pains or anything like that, you can just come in and we'll be able to assist you.
Okay, and I think you said it earlier, but again, you were breaking up a bit there. So the hours that this is all going to be happening, give us the hours and the days.
Oh, sorry about that. So the hours were open from 7 a.m. in the morning until 6 p.m. in the evening, and that's Monday to Saturday weekly.
Okay, all right. So that is good news there. Rashan, some of that, we've talked about LAMP before, but tell us what that is and then what's new. We've got some exciting things happening, but get us all up to speed on what LAMP is.
Yes, most definitely. Good morning, everyone. So, LAMP is our Loyalty Advantage membership program at Doctors Hospital. That is our flagship plan there, which offers affordability and accessibility to the services of Doctors Hospital. So, as you see, we are expanding. And once Doctors Hospital expand, that means LAMP is also expanding to these various locations as well. So it's going to help you reduce the out of pocket costs on your outpatient and inpatient care services. It will be offering free preventative and wellness care benefit. And for those who have existing insurance, we have a supplement coverage for you to ease the cost of care as well. And then, of course, our plans are for individuals, for families, and of course, even employee benefits. So LAMP is really doing some good things there. LAMP, with the opening of the clinics, each plan will tie in with lab benefits, with the physician visit benefits. Newly, we had our LAMP access plan, which is a discounted plan. So even if you're not a paid member, you can still get 10% off of certain services for free. So that's 10% off your blood work, 10% off of your imaging services, and 10% off of medication. And like I said, the plan is free to sign up. So once you sign up, you get that 10% off. For our LAMP insured members, that will offer co-pay waivers. So at the location at Carmichael, those lab services and those physician visits, those medication, we will cover the co-payment for you. So it's almost like you're covered 100%. And that plan there is $30 a month. For our members who would be uninsured, that's the LAMP prepaid. So for your lab services, they will get 30% discount. Nobody offers that nowhere in the Bahamas. You cannot get 30% off nowhere.
Wow.
Seniors don't even get that percent. So you would get 30% off labs, 30% off medication. And guess what? Your physician visits for prime care is free of charge. So if you want to go to the clinic 100 times a year, it will be free as long as it is covered, as long as it is primary care visits. And then, of course, for our NHI members, even though your labs are covered by NHI, for those that are not covered by NHI, we will offer you an additional 15% off of your labs and 15% off of your medication. So it's a lot of benefits underneath the LAMP program.
That's incredible. All right. So, what's the response been like so far? I mean, this is incredible sounding. How's the public been reacting to it?
To the LAMP, it's listen, now that COVID is, drifting away slowly but surely, persons are now more interested about LAMP, and especially just to take care of their basic healthcare needs. They want to get their annuals, they want to get their screenings, and they just want to know that they are okay. And to have a plan that is very affordable and offers all of these benefits says a lot. So persons are calling. I must say, every time we have a pop-up or a radio, listen, the phones, they ring.
I can
So,
imagine.
And guess what? There's no physicals, there's no age requirements, and there's no pre-existing conditions that are considered. LAMP is for each and every person.
Are you able to say the range of the premium for the LAMP program?
Yes, so we have two that are free, which is the access plan. That's a 10% discount. And our NHI plan. So how our NHI works is as long as you sign up underneath NHI, you will get some additional benefits for free. So that as well is also free. But for the LAMP insured, it's $30 a month. And for the LAMP prepaid, we ask for $40 a month. And you have that back. So that's $33 and $44 for our two paid plan. So it's pretty affordable.
All right. So you said no testing is required. So, but how do you sign up? What do you do?
So sign up is very easy. You can visit our website at doctorshosp.com. That's HOSP as in Paul.com. And the link is right there. Everything is online. We made it very convenient to the customers. Once you complete your enrollment form, you will get an email to follow requesting for payment. Onboarding takes about 2 to 3 business days. You get your email to let you know that you're on, and our cards, our membership cards, are digital. So, like I said, it's pretty affordable and accessible. You get a lot of benefits once you are a LAMP member. And I only touch on some of the benefits, but if our viewers want to hear more about it, you can always give me a call at 825-5267. That's 825-LAMP. Trust me, I answer that 24 hours a day. Our members tell you.
24 hours a day?
And the hours are only 8 to 5, but I still go ahead and answer the phone call.
Okay.
That's how much I love my members.
Wow, Rashan, that's amazing. Okay, all right, and then cash. If you are still using cash, how do you do it? Do you have to use a card to pay for this? How does that work exactly?
So most definitely. So no is never an answer. We will take your cash. We have online methods. We have bank transfer if that works for you. We facilitate cash at any of our locations. You can pay at CMC Clinic, at Centerville Medical Center. You could pay at the main hospital. You could pay on Dalsworth Street. And I'm sure now that Carmichael Road is opening, we're going to also be accepting cash there as well. So we accommodate all payment methods.
Okay, wonderful. We've got a couple questions. We have a few minutes left. Somebody's asking, they're saying it's funny but relevant. It's not funny. It's a serious issue. Does Doctors Hospital provide mental health testing? Is that covered here? And then they start to talk about some people who need mental health testing. Oh boy! But the mental health issue, is that covered at all under this?
It is not covered. However, I do know that we have, I got to look at my email right quick, but we do have a specialist that works along with Doctors Hospital in that particular specialty. But unfortunately, that is not underneath the LAMP program.
Okay, not yet. I'm sure.
But I'm gonna give
right.
I'm gonna give the name of that specialist shortly.
Okay.
I just have to look for it.
Wonderful. This one's asking, I think you said this already, but is there an age limit? My grandmother's 88. Is there anybody who's too old to be on the plan?
There is no age limit from the cradle to the grave.
Wow.
It does not matter your age.
Mm-hmm. That is wonderful. All right.
Yeah.
And as you said, it's going to be available. The services will be available at Carmichael, and which is starting today. So it all comes together nicely for people who can't get to Shirley Street there, and so that's going to be great. This text here, and you said, they want some clarity on when you said the co-payments are covered by LAMP.
Okay, sure. So before I answer that, just let you know that physician is Dr. Richard Adderley, if I'm not mistaken. He works along very well with us. He deals with that anxiety and mental health. So I do not have a contact number for him, but that's Dr. Richard Adderley, okay? That's one of the physicians I could give you for that.
Great.
So in reference to your co-payment, so normally persons who have insurance, and we basically deal with the major medical insurance, so that's your Colina, your Bahama Health, your Atlantic Medical, your BAF, your New Providence Life, those major medical insurance. So co-payments is the responsibility for the patient. Even though they are insured, normally you would have a 20% co-payment for labs or 20% co-payment for medication. That responsibility that you have as the patient, we will take that on for you. We will say, hey, LAMP have this, LAMP will cover that for you. So it's almost like you're going to be covered 100%. Your insurance will take care of half, and then we will take care of that co-payment. So that's how easy it is.
Okay, wonderful stuff. All right, so again, let people know how they can reach you, how they can contact you for more information about LAMP, and also, Marissa, about Doctors Hospital Carmichael.
So for LAMP, like I said, you can contact me at 825-5267. You could also email us at lamp@doctorshosp.com, or you can check our website, doctorshosp.com/lamp, and we'll go from there.
Okay, wonderful. And Marissa?
All right, so you can contact us at 302-3270, and we are here to answer any calls or any questions that anybody may have regarding our services here at Doctors Hospital at Carmichael.
Okay, wonderful stuff. This is wonderful that what Doctors Hospital is doing, and we appreciate it and appreciate you both, Rashan Simonette and Marissa King. Thank you. Good stuff.
Thank you for having us.
Thank you.
All right, we're going to take a break and be back with Morning Blend Business. We're talking with PMU and NIB. That's coming up in just a bit. Stay with us.
Around the world, Cleveland Clinic is recognized as a leader in healthcare. Our team of experts relentlessly pursues the best for our patients. From groundbreaking cancer research to state-of-the-art heart surgery, life-saving innovations happen here every day. When it's time to travel for your health, it's time to travel to Cleveland Clinic. Your destination for care. For every care in the world. To learn more, visit clevelandclinic.org/Caribbean.
Wake up. Switch for better when you move your mortgage to Scotiabank. Leave behind that old mortgage plan and open the door to a low interest rate. No payments for up to 2 months and cash back of 2.5% of the mortgage amount up to US $10,000. And guess what? It gets better. Apply for your Scotiabank credit card and enjoy a low 9.99% introductory rate for the first 6 months. Switch for better and upgrade your mortgage today with Scotiabank. Offer ends June 30th, 2022.
This is Guardian Radio 96.9 FM, Nassau, Bahamas.
The views and opinions of the host and guests are their own and do not necessarily reflect the position of the management and staff of Guardian Network.
Wake up. It's a new day. Wake up. It's a new day.
Good morning and welcome to Morning Blend Business on this Monday, May 23rd, 2022. Welcome back to our Morning Blend listeners. Once again, I'm Dwight Strachan along with Pamela Musgrove. And this morning, we are talking with the president of the Public Managers Union, Frida Cartwright-Lewis. Finally have her in studio with us. We've been trying to organize this for a little while now, but great to see you. Good morning.
Good to be here. Good to be here. Good morning.
All right, so you were telling us off air that we've been talking about NIB, but that's not the only union that you or entity that you represent. Tell us all what the PMU is all about and who all you represent.
Well, good morning. We represent the National Insurance Board, the University of the Bahamas, Bahamas Air, and the Airport Authority.
Okay.
The middle management at those entities.
All right, so that's a lot of people there.
And so, yes.
About how many members would you say you have?
In excess of a little bit more than 300, close, mid 300.
Mm-hmm. And over the last few years, there's been challenges with all of those.
There has been some challenges.
Yeah.
You know, we would have had, with Bahamas Air, where we would have signed our industrial agreement from 2018, and we're still fighting back and forth trying to get the document registered.
Wow.
We would have completed our negotiations with the University of the Bahamas in December of last year. All of the financial obligations, the outstanding financial obligations have been met. Regrettably, we've not been able to actually finalize the document and have it signed off to be registered. And of course, we have the National Insurance Board that has been outstanding now for the last 29 months.
Wow. Okay. So we're going to get back to the other ones in just a bit, but let's talk about NIB. You've been in the news a lot because of that. What exactly is happening there? Give us the surface answer, and then we'll go deeper from there.
Okay. As a result of the negotiations with NIB at this time, we have one outstanding matter, and that matter is relative to contributions, okay? The National Insurance Board is asking us to be tied to contributions. In our present industrial agreement, we were tied to contributions. But there was a whole process involved whereby we were tied to contributions. The National Insurance Board was supposed to have implemented a performance-based system that complemented us being tied to contributions. The National Insurance Board was supposed to have ensured that all levels of staff, including the executives, be tied to contributions. Our concern now is that the major component of that program, which was the performance management system, has not been rolled out. And so we are simply saying to management, let's reconsider. We are asking to be tied to performance as opposed to contributions.
So if contributions go down, there would be no bonuses or anything for...
If the contributions, the budget is not met,
Mhm.
it means that your all emoluments in terms of your increments and your bonuses is tied to that. Okay?
Explain tied to contributions for the audience. What does that mean?
Okay.
When you say tied to contributions?
Presently, if the board doesn't meet its targeted budget, it means that we would have to be at their mercy in order to receive an increment or a benefit. Okay? In its present form, it is not a complete system. Okay? The contributions of NIB has so many variables. Okay? If the economy goes south and you as a businesswoman has to make a determination whether I'm going to pay national insurance or I'm going to keep staff, what will you do?
So basically,
Okay.
the arrangement is if contributions go, when it's tied to contributions, your bonus depends on the amount of contributions that national insurance collect.
Whether or not the board meets the budget, targeted budget.
Okay.
Okay? In our industrial agreement for many years, the agreement states that the board and the union, in consultation, should should decide what the budget should be. It's been a fight over the last umpteen years. That has not happened. The board gives us the budget and says, this is the budget. No consultation. We have the Family Islands. We have New Providence. There's no consultation with anyone in those offices to decide. We have a situation, if memory serves me, in, let's say, Long Island, where I'm being advised that they have increased the budget by 525% at a time like this when we know the economy doesn't support that.
So do they say which areas they increase the budget? Like, is this salaries? Is it capital works?
No, this is the contribution budget. Okay?
So by raising that means it'll be harder to meet that target.
In most instances,
Right.
it's harder to meet the target. Mind you, in many times we've met it, but there are times when we haven't.
So what basis is used then? Okay, when you said budget, I thought you meant budget for the operation of the board, not the contribution.
basically a
part.
target.
So what basis are they using to say that they are going to collect an additional 525% more in contributions from the workers?
Not from, okay, that's only for one island I
That's what I'm
was
saying.
referring to.
What basis they're using to determine that?
There are some formulas that the board uses, okay? And we have said, listen, talk to us. We're on the ground, okay? You have situations where prior to recent times where, okay, you have persons who are in need of, who are vying for contracts at various ministries. They would register. So as far as NIB is concerned, if that company is registered, you are expecting contributions from those companies. But because that company is registered, it does not mean that monies will come in from that entity. Okay? Because in some instances, those persons never get the contract. But those are at times taken into account
when they're determining the budget.
They're determining the budget. Okay? We have a situation where the inspector department, the compliance department, and the legal department are solely responsible for the collection of contributions. Okay? They're not tied to it. They're not tied to it. So what you're saying in essence, Mr. Strachan is the talk show host. The marketing department is responsible for marketing 96.9 to ensure that the persons are buying ads, funds are being brought in. But Mr. Strachan is being measured by what the marketing department is doing. Okay? How does that make sense? And that is all we are saying. We are also saying, if you don't understand the process, let's talk about it. Let's talk about it.
How long has this system been in place now?
This system has been in place since the last industrial agreement. We are now saying,
What was it like before that?
It was just that system minus the performance management system. We are seeing where it's disenfranchising many of the managers. And so we're saying, let's take it out, let's fix it, and then decide how we're going to move forward. The staff, the management staff at NIB, they deserve better. Okay? The executives are not tied to it. The executives are wanting us to hurry up so that they can get their increases. And their increases comes automatically. How do you, as the policymaker, we manage staff. The policymakers themselves are not tied to it.
So what do you think the rationale for this was? To get the staff to work harder by making the managers put more pressure on them, or to collect? Is that what you think was going on here?
When I look at the spirit and the intent of it initially, it appears to have been a very good system. It appears. Had they rolled out the entire system, whereby all levels of staff, executives, and other staff members were included, also the performance management system, along with that, you would not have the problem that you have today. Okay? But you cannot hold on tight, fight for something that is not complete.
Right.
So if the government were to increase the rate for national insurance, how would that affect your situation?
I am not going to get into what the government has to do.
No, I just said if the rate were to increase for the rate that we pay as workers, how would that affect your current situation?
The sad reality of that is that there is an attempt to link the two together. Okay? Let me give you another example. We have the Inland Revenue Department now discussing the deficiencies that they are having with the collection of revenue. Okay? Can you tie the staff at revenue collection to the collection of the revenue? There's no difference. There's no difference. There are so many examples that proves this system that the board is trying to implement or trying to continue. There's so many examples to prove the system is not effective. Okay? And see, the thing of it is, my difficulty is that you're fighting tooth and nail, knowing full well that the system as is incomplete, and it is more beneficial to all parties, the board and the staff, to just step back, remove it at this time, work towards a proper system, and then move forward. The union has suggested, along with their initial agreement, right, is for the first 3 years, we decide to be untied to contributions. And in the 4th year, the board and the union sit down, and the caveat to that is so as to ensure that all parties take an interest, proper interest. We've agreed that we'll accept being tied to it in the 4th year, but with a view of working a system that is favorable to both us and the board. And then in the fifth year, then we move forward. But you are fighting us tooth and nail, full well, knowing that the system,
They're insisting that this stay in place.
that this stay in place.
So your members are tied to this system, but the executive will get their increase.
No matter what. And non-management.
That's a little problem.
My goodness.
And here is another problem that is now festering. For the last 3 years, non-management has received their benefits. So we're now in a situation with the salaries and anomalies will take place.
Now, you've been meeting with government, so you're saying this.
We've been meeting with NIB, yes.
With NIB?
Yes.
All right,
yes,
not the minister.
We would have had one meeting with the minister, and I would say this: there are 2 things I agree that with what the minister has said, and one is that yes, NIB is having some challenges. 2, that the Public Managers Union have been cordial, okay, but at the same time, we must do what we must do.
I think that
okay.
inequity
That's all that
needs
you
to
all
be
agree
addressed.
on. That just those. I mean,
Well, also, I would make a correction. The minister has indicated that the Public Managers Union does not want to be tied to performance. That is not so. We do not want to be tied to contributions. We want to be tied to
to your own
performance.
performance. And how would you measure your
Okay.
own performance? How would you? What would be the measuring sticks there?
Well, the measuring stick would be putting in place a system where, let's say, example, let's say central benefits, okay? If you say to central benefits, and I'm just using figures for an example, if central benefits has 100 claims to process in 5 days at 90 to 95% accuracy, they would have met their target. That is the performance target that the board has put in place. Okay? And bear in mind, I'm only using the figures for sake of example. So if that department meets that target, then you turn around and say to that department, I cannot give you your increment or your bonus because the board hasn't collected its contributions.
Okay.
That makes sense?
Okay, so can you reconcile? I believe that if middle management, if your bonus is not tied to contributions, I don't think executive management should have their bonus tied to contributions as well. I think that inequity needs to be sorted out.
You mean that if ours is tied, then there should be tied?
Yes, whatever you your members are doing, I think executive management should be on that level as well. I think that inequity really needs to be sorted out.
It needs to be sorted out.
Okay.
And you know what is very concerning? Executive management knows the spirit and the intent. But who has the will to speak up? Or is it that they benefit, so it doesn't matter to them?
I mean, they're getting
what
it.
is the right
so,
thing?
Yeah.
Yeah.
What is
So,
the right
but
thing?
Can you reconcile this performance being tied to contributions, right? Okay, so for instance, the last couple of years, contributions would have been way down.
Contributions would have been down.
Because of the economic situation.
Right.
So can you reconcile where the minister is coming from? That, okay, if we go according to performance and let's say you did well and we have to give you an increase, we don't have the money because we're not getting the contributions. Is there any type of middle ground that you can come to in order that the national insurance, the fund isn't paying out money that it really didn't have or didn't receive in?
Right. When you take out a mortgage and for some reason you're not able to pay that mortgage, the bank says to you, come, let's sit down and let's talk.
Let's reason together.
Let's reason together. And so, likewise, if the problem exists with the board, we can sit down and reason together.
Okay, so that's what's missing. Okay.
And that's what's missing.
Wow.
Okay? At the same time, the same eye that you were looking at and saying that we don't have it to give the management staff,
You can't
it's
give it
the
to
same
executive. I agree
eye that you're
totally.
looking at
Yeah.
This whole time.
Yeah.
the whole time, but you're able, or you are doing it for others.
I agree totally.
Wow. So we've been hearing a lot from the board and the minister and everybody about the challenges facing NIB. And for the public out there hearing this and hearing what you're saying, this is along with what Pam is asking. I mean, how do you reconcile that you know, the fund could collapse if we don't do some serious damage? And you're talking about bonuses, basically. What do you say to folks who are like not understanding your position?
Okay, I would say to folks that the important factor here is management. Leadership, decisions. NIB did not just get where it is yesterday. Here's why I say that. We can go back to 2000, as far back as 2005. We knew that this was going to, we were going to come to this. Okay? We did not manage it. And so 2022, we are where we are. In 2006, the National Insurance Board embarked on a program where they offered a voluntary package to take the numbers down, to cut the costs, and to manage the system.
This is for managers or
This
for
for
across
all-
the board?
Across the board.
Okay.
2006. So it's not like we don't know what we needed to do. The question is, do we have the will to do what needs to be done? We are now up to in excess of 600 staff members. My last check.
Wow.
Okay?
What were you at when the package was offered?
We went to below 400. Okay?
How did this happen? Why?
Okay? Another thing is the board introduced in 2014 a new system called V3. Okay? It was introduced in 2014 and rolled out in 2016. The intent of the system was to improve performance, productivity, and manpower. Suffice it to say, like the minister say, the people will decide. Because we would have gone from working claims, 7 to 10 days, to now you would hear the public complaining.
Yeah.
Right?
Right.
We would have had the public complaining about calling national insurance and not being able to reach national insurance.
Yes.
We would have invested recently in a new phone system. Okay? And so we got to look at management. We got to look at decisions. We got to look at leadership. And we got to look at compliance with the National Insurance.
This is pretty
Act.
serious. You've got more people than before, and it's taking long to get things done. And so what's supposed to happen here?
She says leadership.
Yeah.
And leadership needing to be assessed and not just automatically given bonuses when the performance is not at par.
So you definitely don't need more people, and more people won't increase the efficiency of NIB.
More people will not increase the deficiency at NIB.
Yeah.
Proper management, proper leadership, proper decisions is what is needed.
So what do you think the staff complement should be?
I would definitely not. I'm not in a position to speak to that.
But you were functioning when you were under 400.
We were functioning. Okay. But again, like I said, will, desire, and what is right.
Wow. All right. We need to take a break. When we come back, we're going to find out if there are any other pressing issues with NIB, and then we'll get to your other entities that the PMU represents. We'll get to that. We're talking with Rita Cartwright Lewis here on Morning Blend Business. This is a Monday morning on Guardian Radio. Stay with us.
History has taught us that in crisis, humanity will always respond with innovation. What world-changing technologies will emerge from humanity's latest challenges? How can the Caribbean capitalize on the metaverse, blockchain, hybrid work, and more? Join us at the RF Economic Outlook Conference under the theme Future Forces, World-Changing Ideas, where we will explore the future of work, investments, technology, and more. The journey begins on June 8th. Reserve your seat today at www.rfeoc.com.
We know how important collecting your money can be to the success of your business. Start your relationship with Fidelity today so that we can show you the many options available to you with our merchant services. From click and pay options online to merchant terminals and e-commerce options. We're here to help your business succeed. For more details, speak to one of our business development officers at 356-7764 in Nassau or 352-6676 in Freeport. Visit our website at fidelitygroup.com or visit any of our branches.
Scan on Bahamas, it's your boy Sawyer Boy. COVID is clearly unpredictable. It doesn't matter how young you are, how old you are. I'm young, and it still put a beating on me. I had no other option but to go to the hospital. I remember the doctor telling me if I had waited one more day, I wasn't gonna come inside here alive. You don't wanna be in the same position that I was in. Vaccines may not stop you from getting COVID, but it can stop you from getting COVID the way I had COVID. You don't want that way.
Imagine driving your dream car, doing all the things you never thought you could, like perfecting your parallel parking skills or picking up your date. Everyone loves to dream. Stop dreaming. Start driving with a brand new offer from Scotiabank. With an auto loan from Scotiabank, benefit from no payments for up to 2 months, a low interest rate up to 9 years to repay, and free insurance for the first year up to 2.5% of the loan amount. Promotion ends June 30th, 2022. Stop dreaming and start driving today with an auto loan from Scotiabank.
It's time for your morning business report brought to you by CFAL. The two Crystal cruise ships that were arrested by Bahamian authorities in February are now going to auction next month. An article on Maritime News website, the Maritime Executive, revealing the Bahamas' Supreme Court published a notice of sale for both the Crystal Symphony and Crystal Serenity. The ships were seized by Bahamian authorities after a Florida court ordered the arrest of the Crystal Cruises vessel when the company was sued in January by its fuel supplier over unpaid fuel bills. The litigation began after it was announced in early January that Crystal's parent company, Genting Hong Kong, went bankrupt. Bahamas First Holdings Chair Alison Trico appealing to the government and the central bank to allow property and casualty insurers to externalize a portion of their investment portfolios, citing the limited pool of investments available in the country. In its 2021 annual report, BFH reports total investment loss of $0.9 million, which represents 0.4% return on investment. With total equity up to $65.6 million at the close of 2021, the company also revealing it had an unrealized loss on its main equity investment in Commonwealth Bank of $1.7 million, albeit an improvement from the $2.9 million in unrealized loss recorded in 2020. Read more about her comments in today's Guardian Business section. And Bahamian entrepreneur 34-year-old Alexio Gibson got the Shark Tank seal of approval after his company, the Transformation Factory, got a 20% buy for $600,000 from Sharks Kevin O'Leary and actor Kevin Hart. Gibson's million-dollar company has taken a common Bahamian product and turned it into the mainstream by producing fruit-flavored sea moss gels, which Gibson says he was looking to take retail. Gibson, born in the Bahamas and raised here, but currently living in Florida, told the Sharks that his company has about $3.5 million in sales just 11 months into its formation, with a 35% profit margin. Read more about it and about Gibson's appearance on the season finale of Shark Tank last Friday on ABC in today's Guardian Business section. Overseas, in a memo to employees today, Starbucks saying it is pulling out of the Russian market. The Seattle coffee giant said it decided to close its 130 stores and no longer have a brand presence there. Starbucks says it will continue to pay its nearly 2,000 Russian employees for 6 months and help them transition to new jobs. Starbucks' move follows McDonald's exit from the Russian market. Last week, McDonald's is selling its stores, which are almost all owned by the company. They're selling them to an existing Russian franchisee. The stores won't be allowed to use the McDonald's name or menu. Starbucks stores are owned and operated by Al Shaya Group, a Kuwait-based franchise operator. Starbucks entered the Russian market in 2007. In early March, after the Russian invasion of Ukraine, Starbucks announced that it would keep its Russian stores open but donate any profits to humanitarian relief efforts in Ukraine. And health officials are investigating a multi-state salmonella outbreak in the U.S. they believe is linked to some Jif peanut butter products. The FDA, the Food and Drug Administration, along with Centers for Disease Control and Prevention and other state and local health agencies are investigating an outbreak of salmonella. As a result, the J.M. Smucker company is recalling many of its Jif peanut butter products produced at a plant in Lexington, Kentucky for possible contamination. So far, 14 people in 12 states have reported illnesses linked to the outbreak. 2 were hospitalized. According to the CDC, all 5 people who were contacted had reported eating peanut butter, with 4 of them specifically eating Jif peanut butter before getting ill, according to the CDC. The release from the FDA says that an analysis based on the 2010 environmental sample has linked the current strain to the plant in Kentucky, and the FDA's investigation is ongoing and more information will be provided as it becomes available. Consumers should not eat, and restaurants and stores should not serve or sell any of the recalled Jif peanut butter products, which were shipped nationwide, and the products have a 2-year shelf life, so consumers should check that they have any on hand. The products have a lot code numbers 1274425 through 2140425. Some Jif products with the same lot code were shipped to Canada and have been recalled as well. In your Market Watch, recapping trading on the BISX. Your market movers from Friday: Consolidated Water moving 702 shares, closing unchanged at $2.59. Emera Incorporated unchanged at $12.08. The BISX All-Share Index closing at 2,447.60, unchanged. That's your Market Watch, and that is your morning business report brought to you by CFAL, growing wealth for future generations. And tune in to CFAL Talks tonight, right here on Guardian Radio 96.9 at 6:30 p.m. We are back here with Morning Blend Business. Dwight Strachan along with Pamela Musgrove. We are talking with Frida Cartwright-Lewis, the president of the PMU, the Public Managers Union. All right, so we've heard a lot of talk about the challenge with collections and people not paying they're collecting the money from their employees, but they are not passing it on to NIB. What can be done in this to get those contributions up from your perspective? What do you see? Do we need to go after the employers? Do we need to prosecute, put people in jail? We hear very little of that, and we know this has been a major problem. What in your view, needs to happen here?
Okay. Mr. Strachan, we all as Bahamians know what our obligations are. We all know what the purpose of NIB is for. Okay. One of the challenges that we have in terms of collecting of contributions is if I come to your business and I ask you to see your books, right? And your books is registering 10 employees. We go by what your books say, right? But you have 25 employees.
Wow.
The level of dishonesty plays some role. The inspection by the relevant persons have some role to play. And so I'm now retired from NIB, but I would have had a situation where during the COVID season, a very prominent employer called to say, listen, I haven't been paying my national insurance.
Wow.
Okay? That employer file was processed to be sent on to compliance for prosecution, but hadn't made it to that point of prosecution as yet. What can you do for me? I said, nothing other than follow the law as it relates to NIB. There are so many challenges,
I mean, what do they want you to do for them?
The public has had so many things to say about NIB and persons' monies being collected and not paid into NIB. But some years ago, NIB introduced a program called Know Your Contributions. You as an individual, whether you like it or not, you also have an obligation to come into national insurance from time to time.
Yeah.
And say to us, please print my record.
See, that's a problem.
Okay.
Because I think that should be online and easily accessible.
Online. It is online.
And that should be a program where national insurance continuously tell employees to go online because I think you have to apply for a PIN, and then someone has to send you a PIN, and then you go online to see your contributions.
Right.
Yeah, that has to be easily accessible for
But
person.
it doesn't even matter because when you find out something's wrong, does anything happen to the employer?
Yes,
Mhm.
if we find it out. Remember now, there's a NIB has programs in place in terms of if you're not paying your contributions, NIB comes after you. Okay? But we wouldn't know that your contributions is taken out and not paid to us if we're not aware that you're an employee.
Yeah. No, I agree. There needs to
Okay?
be more on that.
There's
end.
so many variables around why contributions aren't being paid. And, we as individuals, sometimes we have to take some responsibilities. Believe me, I am not blaming anyone. NIB has an obligation, and you as an employee have an obligation.
When was the
Because
last time someone was convicted? Though? Can you tell? Do you remember?
I think I would have read in your paper just recently that for the year they would have 340 persons were hauled before the courts.
Yeah.
And so I know that there's action being taken.
Okay.
But I also know there was a time when we were active enough where we actually had our own court, where we had sufficient cases where we were assigned our own court. So the question is, are we doing due diligence in terms of, in that respect and that regard?
I remember a few years they were saying they had a major backlog, and they weren't up to date with all the contributions. Has that been resolved?
Okay, I am not able to speak to NIB directly what the challenges are now, because as I said, I'm no longer employed with NIB, and there are some things that it would not be right for me to speak on, and that is one of the cases. But I do know that that is something that many persons are concerned and complaining about. Their contributions not being registered.
Right.
Yeah. So I think what NIB needs to do is deal with HR to ensure that everybody that is contributing to NIB has a user ID so that they could log on to the system, and then they could change their password afterwards so that they can have access to see their system. Because I tell you, many persons will not. I had to deal with NIB to go on that line just to pay contributions. That is, you have to take a half day, possibly lunch, vacation
right
to
back,
do that.
Let's go right back to my first discussion. Leadership, management, processes.
Yeah. Now you said something.
We can't get nothing. Everything rises and falls.
Yeah.
On leadership, management, and priorities.
Let's talk about leadership. You talked about this off air. I don't know if you don't want to say it on here, but you mentioned something very interesting about the number of people, directors at NIB. How many have you had, and in the last few years?
Well, within the last few years, within my last count is in the last 9 years, we are now on our 5th director, which for me seems to, for me, it destabilizes the organization. Because every time somebody comes in, they come in, they don't like what the next person doing, irregardless of how impactful it is. Everybody wants to make a name for themselves at the expense of the organization.
Wow. We got a few questions here. I want to get to these. We don't have much time, but I do want to find out with the person who asked, "What can you do for me?" I mean, what did they expect? What was supposed to happen there?
I don't know, because I am not going to Fox Hill Prison for anyone. Not even. I'm not going to prison for no one.
What do you think he wanted? What could you have possibly done?
And then, is there equity with dealing with persons? Like, if you report somebody, will it go through the process? If they are known to the people involved, you see, so there needs to be equity that it doesn't matter who it is. You go through a process.
Before we go on, let me do this, please. I would like to say good morning to the staff at NIB.
Sure.
And I would like the public to appreciate and understand the challenges that the staff at NIB has to go through to service them. It is not easy. It is not easy. We have a problem with the system. We now have a corrected phone system. Okay? And they are having challenges of their own in trying to ensure that they are able to service the staff. It has been a challenge for the National Insurance staff over the last several years. You have Hurricane Doreen, where you would have had hours and hours of processing claim, an inordinate amount of claims, and on top of that, we had COVID. So we would have had the entire Bahamas now submitting claims for unemployment benefit, medical benefits.
Yeah.
So, plus, the National Insurance Board was called upon to carry out the social programs that the government implemented. So they were carrying out the National Insurance Program simultaneously with the government introduced programs. And so they themselves would have worked tirelessly. They themselves would have been faced with challenges beyond measure. And so, I want to thank the staff on NIB. And even though I have carriage of management, I want to thank the staff, general staff, management and non-management, for going the way that they would have gone to ensure that the public got the service. Mind you, it was not 100%. It was not 100% perfect, but it was good what was done by the staff at NIB. And I want to thank them for that.
I think, and I imagine it must have been challenging for them, but it goes back to what you were saying about leadership. Because when a customer walks in, the customer doesn't know what's going on behind the scenes and the challenges and the struggle. And so they get frustrated when they're not being serviced properly.
Yeah.
So it goes back to your point about leadership.
Absolutely. Running out of time. A lot of these questions are about NIB, and so I guess the way we'll leave that there. We'll have somebody hopefully come from NIB to answer some of these.
I'm not going to answer any of NIB questions.
No, you can't answer these.
NIB will have to answer their questions on their own.
So folks, stay tuned for when we have someone from NIB on. But we have 30 seconds left. What is next for the PMU with the NIB situation? How much time before you have to take this up in a different direction?
Well, we are hoping. We actually had a meeting on Thursday. And so we are hoping. I have to give credit to the minister who, before now, in his defense, seemed not to have had the proper guidance and information before now, before the time that we would have met with him. And so I have to give him some credit, even though I think that had he reached out sooner, he would have been in a better position than he was.
And the minister now is
Minister
Miles Larota. Right.
Yeah.
Okay. Well, we keep us posted and let us know how this goes. And we know lots riding on you all at NIB. And you mentioned some of the things with the other unions. We'll have you back, definitely. The other agencies that you represent. But thank you so much, Frida Cartwright-Lewis. We appreciate you and appreciate you talking with us today. Thank you. Pam.
Thank you.
Thank you, Dwight. Have a blessed week, Bahamas.
Great to have you with us today. Great surprise. And I'll see you next week. And I'll be back tomorrow morning with more Morning Blend and Morning Blend Business right here on Guardian Radio 96.9. Dwight Strachan, have a great one. Stay tuned for On the Clock with Aaron Green coming up next.
Imagine driving your dream car, doing all the things you never thought you could, like perfecting your parallel parking skills or picking up your date. Everyone loves to dream. Stop dreaming. Start driving with a brand new offer from Scotiabank. With an auto loan from Scotiabank, benefit from no payments for up to 2 months, a low interest rate up to 9 years to repay, and free insurance for the first year up to 2.5% of the loan amount. Promotion ends June 30th, 2022. Stop dreaming and start driving today with an auto loan from Scotiabank.
Ready to save? You can put $100 into the CFAL Savings Express plan and make sure your money keeps growing. Earn interest on your savings while you're sleeping, eating, or standing in line at the bank. Ready to invest? Start by putting $1,000 into our mutual funds and earn interest there too. Because at CFAL, your interest is our interest. Visit CFAL.com to start now. CFAL, growing wealth for future generations of Bahamians.
This is Guardian Radio, 96.9 FM, Nassau, Bahamas.